And the observatory is still functional. And in 1971, under the leadership of Professor M.K.V. Vainubapu, we became the autonomous body under the name Indian Institute of Astrophysics. In 1975, the headquarters moved to Bangalore, and we celebrated 50 years under the name IAA in 2020. And there are a lot of archival material. So you can see that the entire astronomy was carried out by Madras Observatory, then Kodaikanal Observatory, then it branched out as well. So the growth of IAA also is linked to the growth of astronomy in the country as such. Thank you. Okay. This one. So where are we now? We have, so this is the, sorry, this pointer will show only one side. I don't know which one to show, so it doesn't work. This doesn't make sense. I can't be inclusive for the entire audience. So you can see this, the cursor. Well, it's not needed. So we have several observatories on the ground right now. Starting from Kodaikanal Observatory, established in 1899. We have Kavalur Observatory near Vellore, which was established in late 1960s. Then Radio Observatory in Gauribidanur. And then the Hanle Observatory, which is called the Indian Astronomical Observatory, established in 2000. These are the ground facilities. We are also establishing a planetarium here, which is in Mysore. So that's the next step, and it will be inaugurated soon. Apart from that, we also have set up 2 facilities in space. So that is, in this particular century, we advanced our technology to make instruments which can be flown in space, and we flew the UV imaging telescope and AstroSat in 2015. The infrastructure created to create a UV image telescope is also there. Space Sciences Laboratory is established. And this AstroSat was launched in 2015, and it has completed 10 years in orbit. We are celebrating 10 years of AstroSat this year. And UVIT also has completed 10 years, and I worked as a calibration scientist on UVIT. Post that, we also built the coronagraph, which is flying on the Aditya L1 mission. So you must have heard of the Aditya L1 mission, which is at 1.5 million kilometers towards the sun. And that has completed already more than 2 years. And the main instrument, coronagraph, is built by us. And the payload operation center for both these instruments are at IAA. So we process the data and pump the science study data to the users. Apart from that, India participates in the India TMT project, which is a 1,300 crore project for a 30-meter telescope. So I'll talk about it later. But that is the IAA also is the nodal center for executing this project. We started this in 2013. We already completed 10 years of this project. So I just want to give you a history of the astronomy in the country along with Kodaikanal Observatory. Please listen to the video.
Established in 1792 by the East India Company, did outstanding work for more than a century. Following the suggestion of the Indian Observatories Committee, Kodaikanal was chosen as the ideal location for a new facility to study the sun. The Solar Physics Observatory at Kodaikanal was born on 1st April 1899. The observatory started functioning with a 6-inch telescope to image the sun in white light as drawings and lens photographs. A spectroheliograph was also employed to image the sun in H-alpha and Cash and K lines. Both instruments function to this day. The observatory soon attained international prominence after John Evershed joined Kodaikanal in 1907 as the chief astronomer. In January 1909, he was measuring the Doppler shift in spectra across sunspots using the spectroheliograph he had built at Kodaikanal, when he discovered that the gas flowed radially outwards in sunspots on the photosphere of the sun. This phenomenon is now termed the Evershed effect. A stamp was issued on the centenary of this discovery in its commemoration. The observatory has been observing the sun in white light, H-alpha and Cash and K lines, and has one of the oldest continuous records in the world. An older 8-inch refractor was installed in 1954. radio observations from India were made here in 1952. After Vainu Bapu became the director in 1960, he oversaw the completion of the Kodaikanal telescope, hosting a spectrograph which is now fitted with a spectropolarimeter. In 2014, an H-alpha telescope was installed, and soon after, the WOM telescope was installed to image the sun in G-band and in calcium K. The museum is a well-known tourist attraction, and the library hosts numerous historic scientific documents. The full digitization of all historic records of the sun was started in 2007 using a CCD camera and a uniform light source.
Yeah, so I move on to the other aspects of it. The ground-based astronomy has been the driving force for taking data and understanding the universe, because you can actually establish this as observatories, and the telescopes last for decades. So you can change the instrument, upgrade the instrument, etc., etc. So in the country we have this telescope is the 3.6, the largest in the country is the 3.6 meter Devasthil optical telescope. It is operated by ARIES. ARIES also is another autonomous body under the Department of Science and Technology. And we also, the next to it is the 2.3 meter Vainu Bapu telescope. This Vainu Bapu telescope was indigenously made in 1983 in the country. And the Kavalur Observatory is also shown here. So we have several such observatories, but the largest telescope in the country as of now is 3.6 meter. But these have been the workhorse for astronomers, because we've been depending on either taking images or spectroscopy or polarization or whatever. The data is provided by the ground telescopes. But it became very important to have access to space, because several of the electromagnetic radiation do not reach the surface of the Earth. The ionosphere stops it. So if you want to study the high energy astronomy, you need to put these instruments up in space. Of course, the technology needed to create such instruments, including the sensors, is not the same. So you have to develop the technology and also develop the technology to lift it up and not only put it but operate it. So all this technology has to be developed in the country. So with the help of ISRO, we have developed in the country as such. But in international scenario, this is the case where you have all such, so many observatories are operating across the electromagnetic spectrum, and also on the ground. So modern day astronomy is carried out by multi-wavelength data, because you need to understand the physical processes which is happening in any particular system, for which you need to have the access to all the energy range. Unless you understand the entire energy range, you will not know complete the physical process happening there. So it has become a norm now. So any astronomer should have access to data across the spectrum. So overall, the strategy is not only creating such observatories and instruments, but also disseminating usable data to the scientists, so that then only you can actually get the impact of any particular mission or instrument. So if you look at US system, there are several websites where you can actually get the data downloaded freely. So the data is released after a certain time period, after the observations, and the data released is actually science-ready data. So it's very, very usable to scientists. So the data democratization has happened in astronomy in the last 2 decades or so. In India also, you can see a large spectrum range. I'll show you that this is actually in the international scene. But India also has gamma ray observatory down on the ground, where you get to receive the Cherenkov radiation across but on a smaller scale, and the optical telescopes as well as infrared telescopes. The radio telescopes are also there. GMRT operates the radio band. So similar facilities available on the ground on a smaller scale, but in this space we have only limited coverage in the X-ray to ultraviolet visible range. So what we have done is in combining ISRO and the scientific institutions within the country, this is the AstroSat, which is going through testing, checkout in ISRO facility. Then this is making of UVIT. UV imaging telescope is done at a clean room level, because molecular contamination destroys the effective transmission. So this infrastructure completely was developed within IAA, and this is the full scale engineering model. And these are the images. This is completing 10 years in orbit, and this is currently the highest resolution far UV image available after Hubble Space Telescope. HST obviously has the best resolution, but it also has a very small field of view, so you can't cover large part of the sky. Here, this covers a larger part of the sky as well. But this has been, I've been as a calibration scientist, we have been monitoring the sensitivity of it. It is not degraded in the last 10 years. So that also gives you complete assurance on the quality of data. Post that, we have launched this on the same infrastructure was used and slightly upgraded for the coronagraph on Aditya L1 mission, and this was launched in 2023. And you can see this is the other technology, because all these are extremely precise and accurate things to do, because all these, not only the components are precise, but also you have to align them and test them. So nobody gives you ideas or even components or even instruments to make a testing. So you have to create the testing equipments, you have to create testing methods, and then validate it. So all these are our own efforts to create all this, and this has been done, and these are the tests which the detectors and everything, electronics go through, because electronics is a very, very troublesome thing in space, because they misbehave notoriously. So you have to test it and make sure that they don't misbehave. So this is the images which are coming in from there, and we are able to, the most important thing is that this observes the sun always, it will see the sun as though it is always in eclipse. Because you can see the corona only during the total solar eclipse. So you can't wait for total solar eclipse to happen. So this sees the sun always in a total solar eclipse, and you can see the corona, and here you can see the corona as closest to the sun as possible. And not, so this is the closest possible thing. You can talk more about it to Dibyendu, who is more expert on this. Moving on to the other technological development, as partnering for this particular project, India is delivering a lot of important stuff like so this is like a 430 meter. So how do you make a 30-meter mirror? Can you make it a single mirror? Not possible, because it's too huge to handle. It's not possible. So what do you do when you go from 1 meter, 2 meter? How long can you, how big can you make as a single monolithic mirror? We can go up to 8 meter. We can't go beyond that. It becomes very, very tricky to cast a mirror, polish it, handle it, coat it, etc. So if you want to go to bigger telescopes, what do? The idea is not to go for monolithic, but to go for segmented. So you have to make segments and then put them together, and they have to act as a single mirror. Again, technology is required, because it's not possible, because it's very, very precise, accurate movements have to be made so that it behaves like a single mirror. That's what the TMT is about. It's an engineering beast. So India is involved in multiple components, like making a segment and hex cutting it. It's not like circular segments, it's like hexagonal segments. If you look at the James Webb Telescope, if you have seen or heard about it, it's the first segmented telescope up in space. We are trying to do the bigger one in ground. And you have to polish it, cut it, then you have to support it, and then you also know edge measurements, because this has to be up and down, and when it moves, the gravity acts on it. So you have to actively compensate all the support systems, and they can move, so you need to sense how close they are, and also you have to face it, because the focus from each of this thing has to go to the same place. That's called facing. So all this technology, hardware, everything has to be developed. So most of it is developed in the country now, and you can see that these are all, so of that 70% of the contribution is in kind, and of that we have 80% in kind works from India are matured enough to assembly production. You can see a large team of people working on it and getting ready for the delivery. And we also have established a state-of-the-art segment polishing facility in IAA. I'll show you a quick video of that to show you what it takes to do it. So this is the handling of the mirrors itself is very tricky. You have to train people. You can't have a single chip on anywhere. So handling is extremely tricky. So it's a trained team. So these are interferometric measurements. All these are done by engineers. So after the back surface is polished, then you go for the front surface. This is a technology transfer from the US to the India, and our people also get trained in the US. And the same place delivered the JWST mirrors, the technology transfer from the same company. So the achievement is that normal polishing takes 6 months to make one mirror. We can make it in 2 weeks. So this technology. So this is the team which developed it, and this is the polished mirror, the first roundel which completely qualified. And the qualification is done by Caltech. So we have to provide the data to Caltech, and Caltech runs their own software to calculate all the parameters. Of course, we independently calculate it and then validate it. So this is ready for production at our Hoskote campus. So coming to the Hanle facility, so we have been operating this facility for the last 25 years. And major facilities are the telescopes and also the recently established MACE, which is the Bhabha Atomic Research Center has established a 21-meter gamma ray telescope. This is the Cherenkov, based on the Cherenkov radiation. This is also operational there. So there are many facilities which operate there. Just to give you a feel of what the observatories look like, this is part of the, we run a program called the Dark Sky Reserve program in Hanle. I'll come to it, but as part of it, we created a documentary, and this is the teaser for it. So just enjoy the video of this as well. So this is for the public, inclusivity of their culture of Ladakh, we have portrayed in this, along with astronomy. So this is the observatory from the ground, Maze and Hagar. This is Hanle Sky. This is India's first dark sky reserve as well. So right now the temperature is minus 20 or something. So it's very, very harsh, and very little oxygen as well. So it's not a comfortable place at all. But we do support astronomy and for people to look at the sky. So this program is in collaboration with administration, Union Territory Ladakh. This is the People Development Council and the Institute of Astrophysics. So this is actually working with people, and we promote astrotourism there, make the people as astrotourism guides, and they get tourists and they show the telescope. The government has given them telescopes through us, And then we train them how to show the telescopes, and they make money with that. And with increasing number of tourists, it's becoming economically viable. So this is the sustainability part of it. So future, we have two major facilities planned. One is the National Large Solar Telescope on the banks of the Pangong Tso, and of course part of the TMT, and the next UV space telescope called INSIST. Now, as I mentioned, that going to larger aperture telescope, you don't go in making a single mirror, but in a segmented mirror. So we are planning for a 13.7 meter for the next 12 years or so, because we have the technology in the country. So that is the future plans. And these are the activities we do as part of the Hanlai Dark Sky Reserve. And these are the ambassadors who are trained in Ladakh. And so we also conduct star party there. So I stop with this slide. Thank you.
Thank you, Professor Annapurni Subramaniam, for a wonderful talk at a very popular level. I would like to invite comments or any questions that the audience will have. Should I ask?
Sure, please.
Yeah. So you said there are lots of industries which are involved at the
Yes.
component level.
Yes.
So obviously those are tested by ISRO directly. Final vetting, if they have done proper.
Yes, for space programs also, as well as ground telescopes, we involve with industry. So we design it and give it to them.
But finally the vetting is done by ISRO directly?
No. So we are the vendors. So we give them the specifications and we have to test it.
Yeah, that's
so all the
right.
test and control, we have to do it. And what we have to deliver to ISRO is the integrated payload.
So what my question is that what is the scope of innovation in terms of startup companies
Yeah.
who can come in? Is that I hear a lot these days that.
Yeah. So we, as such, for the space sciences program, we have been helping the startups to come and test all the payloads here. For example, Pixel's Firefly, they're all integrated and tested to some extent in our lab. So we have the vibration test facility, because that you need to have the vibration test done. Not only that, all the certificates, parameters are to be handed over to whoever is launching, to make sure that once they launch, they don't break down. So they come, so we do it. At least 5-6 startups we help in qualifying them for space
So
launch.
these are directly spun up by ISRO.
No.
The startup companies?
Startups are their own start,
Their
in the
own
sense they're funded by venture capitalists and things like that. But when they create a space instrument or a payload, that has to be tested.
Yeah.
So we provide the testing facility and also help in actually carrying it out, because they wouldn't know how to carry it out. So we help them to carry it out. There are interests in making startups, but the problem with currently with the autonomous bodies is that we don't have the power to create startup within the system. So, or Section 8 company actually. So we are still seeking DST to give us permission to do that, because there are a lot of youngsters who are willing to
That's
do
what I was
that.
thinking.
Yes.
But if you have innovation complex.
Exactly.
And a Section 8 company, then.
Yeah, so we can also have things like, there are many people who want telescopes, and nobody is building in the country, it has to be imported, because there are a lot of aspects which you need to bring in. Some know-how is in the industry, but some know-how is not there. So we can provide it and we can create one, but we still are in the process of making the framework so that we can do it, and we need to get permission for that as well. Yeah.
Thank you.
Thank you.
Yeah. Dipendu.
So first, as a theoretical astrophysicist and a modeler who doesn't really go and do these observations, but who uses the long-term observations, I appreciate the role that IAA and the observatories are playing. I work on the solar cycle. It's an 11-year sunspot cycle. So we need at least multiple sunspot cycles, so at least a century of data to make sense of it, just like in climate. So I cannot overemphasize the importance of these long-term observations and the importance of these observatories that exist. I think this is important to note in a forum like this. The more nuanced question I have for you is that, when scientists deal with society in terms of building big facilities, we've had grand failures. A big example is the Indian Neutrino Observatory, which didn't work out because due to whatever reasons, we couldn't really deal with the local sentiments. regarding the coming of a big observatory at the location. TMT, the 30-meter telescope, which is the world's largest telescope, which is supposed to be built in Hawaii,
It's also facing.
Mauna Kea, is also facing serious trouble because on a peak which is considered sacred by the Hawaiians. So in Ladakh, you are setting a very nice example of dealing with the locals, integrating them with the astronomical facilities there. So taking your experience or lessons from there, what would be your advice to somebody or a big consortium who are planning to build such big facilities somewhere in India?
Yeah, so it's an important question because when you move forward, you have to integrate the ecosystem into the picture. And of course, to survive there, you need the support of the locals and the locals need you as well. So it is important to be inclusive, talk to them and give the trust is the most important thing. You have to make sure that people trust you. And that trust takes a long way in making adjustments also, because without trust you will not even move a millimeter forward. So it is not possible to work with people. But we have been supportive and also we have been inclusive, and even right now the villagers have come together to work. So we are trying to say that we are not here to take anything out of it. To prove the point, we don't have a visitor center in Hanle. People come here and tell that why is that you have big telescopes, you don't have anything to show us. He said we will not set it up because if we set it up, they will not go to the villages and ask for showing them up. They'll say, no, this will be better than that. Some bias in the mind, people will come here and queue up. And those people will say that now you are trying to empower us, and how can we even get people because they are all coming to you. We said we will not set it up. You only set it up, we will help you, and you manage it. We will not have a visitor center because people should go to the village, not to us. So that is the model. So you have to be very sure that each and every decision you take is inclusive, and make sure that they benefit out of whatever you want them to get benefit out of. At the same time, you want to protect the skies and make sure that the scientific observations carry on. That also message has to be conveyed. So if you know the roles and responsibilities definitely identified and they are comfortable with it, I think it will be a good move.
Yeah, good. Are there any more questions? Else I will thank
Thank you.
Annapurni for a wonderful talk at a very popular level, bringing astronomy at the ground as well as at this height, at the space level. Thank you very much. Yeah. I will now hand over to my colleague, Professor Mohan Rao, for conducting the second speech talk.
Well, after the vast universe and astronomy, we'll come back to the planet Earth. We all want to live long and healthy. That's the reason why all disciplines of science, chemistry, biology, physics, mathematics, computer science, and now AI, all merging to innovate for healthcare. Now we have a lecture by Professor Sanjeev Mishra on nurturing innovation in healthcare. Professor Sanjeev Mishra presently serves as the Vice Chancellor of Atal Bihari Vajpayee Medical University in Uttar Pradesh. Prior to this, he founded and led All India Institute of Medical Science in Jodhpur. His academic journey is marked by exceptional achievements, including graduating with the top honors from King George College, Lucknow, and acquiring advanced qualifications in general surgery and surgical oncology. He has held various leadership positions across AIIMS institutions, promoting innovative research and compassionate healthcare. Internationally, he has been honored with fellowships at institutions like Mayo Clinic and Johns Hopkins Medical Center. With over 230 publications and active participation in medical science societies, Professor Mishra is a recognized leader in surgical science and medical education, esteemed for his commitments and academic excellence and services to understand underserved populations. I know Professor Mishra for many years now. He's a brilliant and very pleasing personality, and we welcome Professor Mishra to deliver the lecture.
Yeah, I can use this also. Good morning. Thank you, sir. It's a pleasure and honor to be here, and I thank everyone at NASI for giving me this opportunity to share my thoughts about innovations in healthcare. I'm basically a surgical oncologist, a person who treats cancer, and went into an administrative position quite early, but it opened up a very interesting journey where it helped me learn so many other things besides operating on patients with cancer. So I'll just be sharing about innovations in healthcare. We've been hearing about innovation for the last 2 days from the top people in the country. So the first thing we would say that when we talk of innovation and invention, invention is the generation of ideas and it's a technical realization. While innovation is a comprehensive process starting with the generation of idea and ending with the successful acceptance by potential users, that is adoption. So the simplest definition for innovation would be its design, development, and implementation of new or altered products, services, processes, systems for the purpose of creating new value for the end user. Our previous speaker highlighted about generating a telescope which is made in India. So that's going to be an innovation. So if we look at India, a population of 1.4 billion, health challenges are there. We have got non-communicable diseases, we have got communicable diseases, there are regional disparities, and we get diseases in pandemic, plus road traffic accidents also do contribute to a major health problem. And innovation is not a luxury, it's something which you need. But a lot of innovations that we see which are coming from outside into technology, they don't go to majority. It's 80% of your innovations are for the 20% people catering in this country. So we have to be looking at innovations which are going to be reaching down the line to the last man in the queue. And leadership is extremely important if we have to nurture an ecosystem of innovation in our country. So if we have the innovations, we can look, there are product innovations and we have products there are service innovations, and then you have process innovations, and certain innovations become social innovations which go beyond your process and the innovation. So a social innovation is on a larger scale which has a major impact socially. And if we talk of the pillars for nurturing innovation, you have to have an evidence for doing it. So you've got systemic reviews, meta-analysis, then the health technology assessments. Then there are frugal designs, then translational pathways, that is from lab to clinic to policy to practice. Then when we talk of innovation, there has to be ethical governance, the ethics about it, and a distributed leadership, that is collaborative networks which are scaling innovations. Why do we need innovation in healthcare? Well, you need to improve the quality of services and the quality of life. And of course, it leads to progress in medicine. We have drugs, implants, devices, then procedures, new surgical techniques, or forms of organization. For cancer, just take an example, palliative medicine or palliative care. It's an innovation in the form of care. In the past, we never talked about palliative care. But that's a big thing now that we talk. It's an innovation in providing care. Then we know all about the COVID, the pathways of prevention, which led to innovations. In the COVID, we had the COVID vaccines, as an example where we developed. But it also led to development of the mRNA platforms in our country, which is the basis for a lot of future cancer therapies. So if you look at healthcare, these are just few examples of innovation there. Then again, if we look at the healthcare scenario in our country, there's a changing scenario of healthcare. What was there 20, 30 years back? It's not the same now. The technology is there in a big way. And you've got, these technologies are disruptive. And of course, a lot of interdisciplinary work. People have slowly stopped working in silos. Interdisciplinary within your own field of medicine and across different branches of medicine. So there is a need for innovation in healthcare. We all talk about disruptive innovations. What actually they are low-cost alternative to existing services. that arise because of the market forces when firms focus on sustaining innovations that eventually overshoot the need of the average consumers. So if you look at it, you have innovation which is catering to the top lot, but then you have something which is low cost. It starts now catering to the average person in the society. If you look at disruptive innovations in healthcare, you've got a lot of them happening. You've got in the diagnostics, you've got patient-facing mobile apps people are working on, remote monitoring solutions, digital platforms, robotics and surgery, ancillary services, 3D printing, AI, and then smaller implants. These are all examples of disruptive innovations which work is happening. And I said before, the levels which we can affect by innovation, they can work at a macro level, which are the stakeholders. They can learn at a meso level, or at a micro level when we actually talk of a patient, doctor, and diagnosis at the micro level at one-to-one, which an innovation can work there. For nurturing innovation, if we look, you have to first identify the problem. And then the identification of stakeholders, and the invention, you have to have an ecosystem for developing innovations. And then comes the prototyping, clinical validation, and commercialization, that is the implementation of the innovation. And to nurture, you have to have a capacity building, you have to create an infrastructure, and of course, leadership and governance is the key to providing the above two. At the All India Institute of Medical Sciences, Jodhpur, we worked with the Indian Institute of Technology at Jodhpur to develop what we said, to look at nurturing innovation. So we thought of a joint program, a common platform for teaching, learning medical technologies, providing also in-house opportunities for collaboration, and also providing a platform for industry partners to collaborate. And the model of in the healthcare is innovation, then you look at promoters, and then you look at adoption of the innovation. So coming to the joint program between the All India Institute of Medical Sciences and at IIT Jodhpur, now we've always been taught from our school days that if you take up biology, you have to be a doctor. If you take up maths, you're going to be an engineer. So they're like, we started putting two different sides of a stream that they never meet. Somehow, we always said they're differently wired. And they're two banks of a river, but we need to make a bridge so that they start meeting. And the brightest ideas come from the young minds. We all start to stagnate after 40. We never come up with a bright idea. It's all the bright ideas across the world, the people who are young. Ideas are always out of box, and they branch out in interdisciplinary areas. And healthcare system is evolving rapidly towards digitalization. And if we really want to take innovation forward in the healthcare, we have to have an amalgamation of doctors and engineers coming together. And at the All India Institute of Medical Sciences, we started out in 2012 as a new institution. IIT Jodhpur was, I think, 5 years ahead of us there. So in a city, we had both the institutions. So we could sit together and work. And what we realized was that you need a team dynamics, that you need to have doctors, engineers, and designers. I agree at the end, because of the way you're trained, your wiring changes inside your head quite a bit. But then we must learn from each other's positives and come together and get involved in innovations. So doctors and engineers, they have a different perception of risk. There are different approaches to solving issues. And again, mixing up of the ideas can really help you. And then with the academics and the industry also should be on board when you have to look at innovation. So the joint program was what we called it was the MedTech program in medical technology. It was a joint degree program offered by the IIT Jodhpur and AIIMS Jodhpur. It was a master's program, a master's PhD, and a standalone PhD. And we also had a joint certificate course on digital healthcare system, which we worked. It was quite a long process to get on board, because we started with the discussions in 2016. Professor CVR Murthy was the director for IIT Jodhpur at that time, and we had a series of discussions where the faculty interacting with the faculty of IIT, spending hours and days together, the medical doctors presenting their problems, what they would like, the IIT people telling what they can do, what they have in their strength, and what the medical people actually want. So there were series of discussions. It also broke the ice with the doctors and the engineers coming together, knowing them professionally. It also led to people knowing each other socially. You finish your work in the evening, of course, you can sit and have a chat over a drink or coffee, whichever you like. And then we had several medical innovation workshops. Then we had MedTech Conclave and identification of like-minded faculty at both institutes. And then we submitted the concept to our academic committee, and IIT took it to their Senate, and multiple modifications were there. And finally, it got approved in March 2020, where Professor Shantanu Chaudhary was now the director for IIT Jodhpur, but he carried the same passion for innovation of working together as Professor Murthy. And then it was in the COVID time, that was August 2020, we started it in a hybrid mode, our first batch which was there. And we defined key areas. We said, well, let's work on diagnostics, AI and data analysis, therapeutics, medical devices, and implants. So 4 areas of medical technologies were defined. Then, and the essence of the program was that to produce deep tech innovators in the field of medical technology, and it was amalgamation of doctors and engineers together, and it did also provide an opportunity for the students to work under joint guidance of faculty members at AIIMS Jodhpur and IIT. So I think it started with the faculty, and it also led with the students coming together to discuss things as the young mind, so that at that level, a lot of discussions also started. Then the core guiding principles were identifying the problem, develop a deep understanding of the concepts required to solve the problems, ideate a research plan, design, and then setting up a prototype, production, manufacturing facility for commercialization. So the program, the 3 programs were that we took 10 students. There were 5 doctors and 5 engineers. There would be 5 projects. 1 doctor and 1 engineer would work together for a project. 1 supervisor from IIT, 1 from AIIMS. There can be more than 1, 2 also, one as a co-supervisor. Then masters could lead to a master's and PhD if you wanted to take it forward after your master's, and also there was a standalone PhD program which was there, and we had 10 PhDs and 5 masters and PhD in medical technology. So this was the outline of the program that we had, and there was no written exam. You had to write an essay of a content, that why you want to pursue, what you have an idea, and it was a sort of a one-to-one interaction to deep dive real life problems, and then you had at the end of it identified 2 to 3 problems where you could work on and then talk with your mentor. And at the end, after this, this is just an example, like from in different branches you can be looking at, in anatomy to cardiology for echocardiography, IPD settings, OPD, cancer management, nuclear medicine. So these are the few areas where they did clinical immersion in. And then the joint program had The doctors spent 6 months time in the IIT learning the basics of your engineering. And the engineers spent 6 months learning your basics, anatomy, physiology, biochemistry, so that we could understand each other's language, what we were talking. And then after that, it was working together, while the 6 months there was a common time that they were spending in the immersion. These are just examples of different areas, a long list from newborn to neurology about intracranial pressures, to 3D X-ray. Then you could have 3D bioprinting and pediatric ground for dental, even dental issues were there. Gait analysis for AI and machine learning. And then if you look at, by the end of it, when we had 7 student, over 25 projects were there. 7 student faculty startups have been there at the end of it. 2 startups have had more than 40 lakhs, 1 crore of grants investors, 2 BIRAC big grants, 5 MSME grants, 8 DBD Biodesign Fellows, 7 have won different medtech hackathons with significant crash files, 5 research publications were there, 8 patents were filed and granted, and 2 Prime Minister Research Fellow for PhD were there. There was no as such exit exam. You had to develop a product and file a patent. So that was the end. So there was no such formal exit exam at the end of it. And of course, we all knew about the Valley of Death, which that's why it's there. And a lot of them did get into it, but I think that's an area where we heard yesterday Mr. Gopal Krishna talking about how the industry should help, especially in this from T4 to T6, helping out the researchers. And then we also provided in-house opportunities for collaboration for developing products, testing and validation. So we had an Indo-Sweden collaboration, and we created an AIIMS and IIT incubation center. So these are just a few of the products which were there. We developed, our first patent was a talking glove, and I hope this works. So you could, with the hand, especially post-laryngectomy patients, you could change into there. It's, I don't know about the. So with your hand gestures, it can change into words there. It can be in different languages. This was in Kannada. And then also in COVID time, we did develop a lot of things for in the COVID, working together. And one of our students worked with IIT Kharagpur, and they developed a birthing or a square tool for delivery purpose. And we established what is called as the Indo-Swedish Healthcare Hub, where we had an Indo-Sweden Innovation Center, an Indo-Sweden Life Center for Cancer Care, and a skill for scale cardiorespiratory metabolic disorders. And this was something which was different, and this was where we would be a ground where you can actually validate your innovations and also upscale things. And this was an open system. We had the Government of India, the ICMR, AIIMS Delhi, and as equal partners which were there in this system. In the first, we validated a lot of products, including a Black Frog, where you could actually take vaccines into remote areas, which is not dependent on there. It was temperature controlled, where you don't just not an ice box, but you have it where you can take it to a desert area with 50, 60 degree temperature, so that the vaccine doesn't go bad. And even also we had developed a cheap defibrillator, where you just plug in and it is charged and you carry it with you, and you can, as a portable defibrillator device. And then in the second round, we also had different things where you could scan, look at a wound and give you an idea about what bacteria would be there or pathogens would be there, and an idea about what antibiotic to start till you get your culture. Then this was something which was a DOSI, which could be a remote monitoring, like ballistocardiography, which you could just put in the bed and you don't have to have and monitor it. Then we had an Indo-Sweden Oncology Center, where we worked for besides treatment, which we were doing, we were as a one-stop where we could, from palliative care to advise about your diagnosis and treatment types. this was in-house at the center for different types of cancers there. This was something which, as an innovation in service. And of course, to upscale the nurses, we rolled out what was a skill for scale, especially for diabetes management, because a lot of nurse think personally it was an online thing where you could just join and then learn, upscale your things. This is primarily for nurses, because they are not that well up as far as the treating doctors. And then we also had working for industry. We had a biodesign center from DBT and a Jodhpur City Knowledge and Innovation Cluster and a Technology Innovation and Startup Center. This was jointly with the Indian Institute of Technology, Jodhpur. And the Jodhpur City Knowledge Innovation funding came from the Principal Scientific Advisor of the Government of India office. And because we took the industry in Jodhpur and the surrounding areas also on board as a part of this, and this platform helped us provide that. And of course, there was a biodesign center, which helped in taking it towards the further development and getting the industry on board. And we had the Technology Innovation Startup Center, which was if you have a product, they would help you in commercialization of the product, which was there. And of course, with time, we had the ICMR start the MedTech Mitra program, which was Niti Aayog, ICMR, and CDSCO was there, which is something big happening at the national level where a lot of funding is being provided. If we look at the pitfalls in our MedTech innovation, so what we tried to address to this was that there's a weak clinical engineering integration. So let's make that strong, that collaboration strong, have a system where you can validate your what you have developed, and this is what the ICMR is doing, that the regulatory navigation is there, but we should have something like an FDA-style guidance there which can help push things. We heard about early stage funding. There's a limitation. That's one area where we should work to supplement. A lot of these institutions, especially the medical, we have no idea about intellectual property, how to go about it. In the medical profession, you're not taught. That's a very big weak point on the medical side. While the IITs are strong as far as that goes, I think that's one thing we're working together on IP, where the medical people are there. But we did have an IP policy at AIIMS Jodhpur. We were one of the first few institutions to have an IP policy. But if you ask a doctor that if I have something, he's happy publishing a paper, but then there is no incentive for him that if I make a Section 8 company, do I become a part of it? Do I get a financial benefit out of it? The engineering institutions have worked that out. Unfortunately, the medical, they don't allow you. Nobody allows you a consultation. You can't be a director for somebody, or you can do a consultancy. No, it doesn't do that. There are too many restrictions. So I think that does pull down people working on that, and I think that's something which should be there. And of course, you have to have the right balance for adoption of a technology in a hospital. And of course, we all know the bureaucratic blockades. And as doctors, to accept something which is Indian, we've traditionally been thought about that whatever we've imported is good, but then that has to match your international standards, what you're importing. Because you can't have an error if I'm treating somebody with a cancer on a radiation machine. You cannot have an error in terms of even in millimeters in planning radiation, because that will have an effect. If you're especially treating, say, head, neck, and if my planning is wrong and I get the spine, the person will land up with a quadriplegia where this spinal cord is gone. So I think those are things which we have to work together and see that the adoption is there, the quality is maintained. And the way forward is, I still feel that this was just one way we took things forward. But now you've got a lot of IITs and AIIMS and other big institutions. I'm not saying only IITs, you've got or AIIMS. There are good institutions across the country where doctors and engineers can come together, learn, and take things forward. And they should not be individual driven. It should be a part of a policy of an institution to take things. And you have to create an environment for entrepreneurship. And innovation implementation is equally important. It should be aimed to reach the last mile beneficiary. And 2030, we talk about, is there. We have to be looking at these organizations like NASI and all the allied health sciences. We've got people from healthcare, we've got people from different backgrounds, so diverse, which is a very, very unique platform to come together, to work, to drive, to create something where drive this innovation thing forward, and you can be the catalyst for that. And as leaders, we must nurture through three commitments: rigor in evidence, courage in implementation, and clarity in ethics, which is extremely important right there. And again, this is our university at Lucknow, and again, the future belongs who believe in their dreams. Dream, but dream with eyes open. That's always is there. And thank you so much for patience.
Thank you. Thank you very much for a very informative lecture. This is a story of AIIMS Jodhpur and IIT Jodhpur. But I think we need to multiply this interdisciplinary or multidisciplinary research to nurture innovation in healthcare and across the country in many other institutions. It's now open for a discussion. Yeah, please.
Yeah, Professor Mr. Nice talk. Actually, I was involved with IIT Jodhpur. As you might be knowing, they had review of the centers when CVR Murthy took charge. I went there multiple times, so I am kind of aware of this program. One of my question is that in the view of the NEP at 2020, I don't know after this, how does this standalone master's program sustained? Because now you can have direct PhD after 4-year BS with research. So that is my worry. Master's PhD is not a problem, but just the standalone master's program. Is there any change?
So I left in 2022, sir, also, Jodhpur. So the standalone master's program, the issue that we were facing was getting the funding for in terms of people who are doing masters, their stipend. Because IIT and there, then I had proposed that we have a research corpus which we have, which we generate, and from that we should be able to fund this master's program. So what I knew that last time, so it's still continuing as the master's and master's PhD, but yes, in long term we need to have more funding for it, and that's what it is about, the administrative side opening for it.
But my concern is also that they can, if they can directly do PhD, if they are 4 years, why would they do masters?
So directly PhD, again, you have to have a post-graduation, sir. It's not that you're doing it after your graduation. A standalone PhD program is somebody who's done their masters and now wants to get into a PhD.
Okay, so this is where I am a little confused, because NEP document says that if you have a 4-year BSc course with research, you can directly do PhD.
That is right. We already
then
have.
why do you need masters? That is the question I'm asking. Standalone masters program will not survive. Yeah, that's what that is my
Sir,
question.
masters and PhD is something. See, you have the, when you are there, in the master's PhD program, sir, how it was worked out that if I want to exit, I don't want to go into a PhD. At 18 months,
Yeah,
I
of
have an
course.
option of exiting in my master's and PhD program. That is at 1.5 years. If I want to continue with my PhD and the end of it, I continue with a PhD. See, the purpose is there. If you're from a medical background, I may do a master's here, and I want to exit my master's. I want to go back to do my post-graduation in a, say, surgery or medicine.
Yes,
or
of course, yeah.
So that option, which is, that is one
but
thing
it
which
will
is there.
reduce the options.
If simply after a graduation in MBBS, I do a PhD. NIMHANS started a MBBS PhD program. Now what happens is, sir, in the engineering background with the PhD, with your there, the acceptance is there. Now with the MBBS degree and a pure PhD, I feel that these people, when they apply for a job, because you have to open up the eligibility criteria there. If you're not opening up the eligibility criteria that a MBBS and PhD is eligible for a teaching job, then don't do a degree where there is no eligibility up. So masters and PhD, everybody will accept, sir. Even with the NEP, with a bachelor's and PhD, MBBS and PhD, you may get absorbed in an IIT system even with a bachelor's and PhD. But in the medical MBBS and plain PhD, sir, as a director, I will still think those one person I did select with the PhD from US, 10 years down the line, he's still facing the flack in the institution. And he says, sir, आपने मेरे को क्यों select किया? मैं USA से क्यों आया यहाँ छोड़ करके?
Any more?
Sir, if I can add to that.
So imaging is used very heavily in both treatment, surgery, as well as diagnostic. And India has a large population, very large number of hospitals. And those machines are very, very costly. Is there any progress where any industry has come up that we will start making an imaging machine?
So there, lot of work is going on, but then in terms of having something actually coming to the market, I'm not really aware about it. In radiation, they have come up with an Indian linear accelerator, but then the acceptance again is not there. See, if I'm a top institution, whether it's a private or there, if I buy the product versus a product which is made internationally, then only that sort of a confidence comes. If I ask that the district hospital should have the Indian product and I have the imported product, you will never have a confidence about this Make in India business. So that is what is happening at a lot of places.
That is true, but we have, as I said, we have IITs and so, very brilliant doctors. Can't we copy or make something like that machine which...
Like the, so like the biosimilars,
Please go.
Sir, about the PhD program, I made under the NEP program, in basic sciences and engineering, after 4 years of graduation, you can go directly into the PhD program, provided you have got 75% or above marks. But if you do not have those kind of percentage, then 1 year additional for master's degree, and then you can go into the PhD
so in
program.
MBBS, nobody gets
Yeah,
above
I'm
75. If
not
you get
talking
above
about
60,
MBBS.
we are very happy.
Yeah, for MBBS, this graduation and after graduation PhD program is no good. They should go for master's program and then PhD program.
We have to be looking at, sir, we also started the program, MD and a PhD at Jodhpur. That is a physician scientist. We were the first to initiate that 6 years sort of a thing. And people did take, because it's like if I do a MD in biochemistry and there is a PhD also in biochemistry, I learn more of lab work when I'm doing the PhD. I learn more of the clinical side when I'm doing the MD. So an MD PhD program was something which is there. A lot of takers in pediatrics, anatomy, physiology, biochemistry. So I think those were the areas where they have to be there.
Madhu has it. Yeah, please.
Yes, please.
I first want to compliment you for taking these initiative and taking it forward. I was just wondering that when we do such programs, we also create models. And then we need to have some progression, career progression, while we are doing this. So have you thought of, like collectively with IIT director and you, how to take this forward? Like I saw that there are startups, there are people who are contributing. But as you said that we need funding further. So was there any, did you make any effort to involve industry at the level when we are trying to do innovations?
So-
as well as invite funding from CSR or by some VC?
So, madam, all those people who are enrolled in the program, because the industry interaction is very strong with the IITs compared to the medical side. That's a big limitation on the medical. So the IITs were driving with the industry. That's why we could lead to startups. When we started, we actually didn't look at that these employability of them getting employed at, say, an AIIMS or a medical college or at an IIT setup. But we were looking primarily for these people who were to get into their own group, to have their own startups or getting into an industry sort of a job. But in the long run, I think as things evolve, and few definitely would get into positions at these institutions, and they would be the drivers again. But I think
think we
funding
need
is
to take
something.
care of that as well.
Funding is something which is very important, and industry, medical side has a big limitation.
Yeah,
Thank you so much.
Thank you, sir.
I just want to ask you one last question. This interaction is going on for a while, and you must have seen many projects. And would you like to share with us any one product or innovation which you appreciated or you like? Any of the innovation which we think is very important, very nice?
I think one of the boys on the dental side, they worked. So well, you have these vascular clips which you put and then you join the vessels together to there. So normally once you put the vascular clips, it turns inwards the cut end. So he had a very simple thing which he said that the cut end gets exposed. It's very simple, which was there. He just had a thing where you just put the adventitial and there. So that was something very, very low cost sort of a thing which he developed. So it really makes joining the vessels job easy. And he was from a dental background. He had these small vascular clips. So that was one thing which
Yeah,
offhand
I think
which
very nice. In addition to producing import replacements, I think we should have our own such
actually we
innovative
have to
ideas.
support in terms of them getting
Yeah,
into the
very,
industry.
very
We
nice.
don't do that.
Thank you.
Yeah, can we close with one last
I have one question,
Professor Mishra has the last question. Yeah.
Sir.
one hypothetical question, and I need an honest answer. Huh?
Yes, sir.
As honest as you can.
Yes, sir.
Okay. So in London, there was the Imperial College of Technology, and they acquired or combined with merger with some medical schools. Now it is very famous in the Imperial College of Technology and Medicine. In Jodhpur, I see the combination of IIT and IIM can be a very powerful institution. I see there is a roadblock because there are two different ministries. But in your opinion, if that happens, would that be a good thing for the country?
I think, sir, it will be a very good thing. But again, sir, the problem always lies at the leadership levels. It's not at the lower level. If people at the top decide to work together, and I said it should not be individual driven, it should be built in as an institutional policy to take things forward. I finished my term as a director, somebody at IIT finishes a term as a director, a new person comes in and says, I don't have an interest. It's not his interest, it should be as an institutional interest. So that's something which is there. See, IIT Kanpur, you're making a medical school. You're putting in so much of money, sir, there. Take my word, as of now, getting right type of doctors to work, you're going to have a tough time.
Yeah. So therefore, if you can call it Indian Institute of Technology and Medicine, whatever, Jodhpur, but the two ministries have to agree, then why don't you put up a proposal like that?
So I wish
I think
I
the
was
ministry
there, I
will be
could have
the-
done it, sir, but I'm
No,
there
but
in Lucknow
we
because
can all
trying
put
to
it up.
work with the technical university to get the engineering and the medical people here. It's a different thing working in the state now to get these two people together to make people believe
Yeah,
that
I think we need to close in the interest of the time. Thank you. We thank both the speakers for outstanding lectures.
I thank Professor Mishra and Professor Annapurni for an excellent talks. Thank you.
Thank you, speakers. Now I would like to request Professor Saurabh Paul to please come up on stage to felicitate Professor Annapurni Subramaniam, ma'am. Ma'am, can you please have you on stage, please? Thank you, sir. Thank you, ma'am. Thank you, ma'am. Next, I would like to request Professor C.H. Mohan Rao on stage to felicitate Professor Sanjeev Mishra. Sir, can we please have you on stage? Can we have a huge round of applause, please? Thank you, sir. Now I would like to call upon stage Professor Vinod K. Singh to felicitate the chairpersons of this session. Can we please have Professor Saurabh Paul on stage? A huge round of applause, please. Yeah. Next, I would like to have Professor C.H. Mohan Rao on stage, please. A huge round of applause, please. Thank you, sir. A huge round of applause, please. Thank you. So, the scientific session followed by the young investigators talk within the scope of biological sciences would be continued in the same hall, which is hall 2. And the scientific session followed by young investigators talk within the scope of physical sciences would be continued in the hall 3. I repeat, the biological sciences track will continue in hall 2, while the same hall, which is hall 2, while the physical sciences session will be proceeding in hall 3. Again, I would like to request the audience for physical sciences, please proceed to hall 3, which is in the opposite to this hall. We'll be starting the session in 5 minutes, so please be seated in the respective halls.
Good morning, everyone. We are starting our session within 5 minutes. Kindly be seated. A very good morning, everyone. I am Yashodhara Goswami, the host of this session. Welcome you all back. We are beginning with the scientific session within the scope of biological sciences. It is my privilege to begin by introducing our distinguished chairperson for this session. With great privilege, we are honored to welcome Professor Sanjeev Mishra as the chairperson of session 10B at the 95th NASI Annual Session and Symposium. Professor Mishra's outstanding career exemplifies dedication, excellence, and visionary leadership in the fields of surgical oncology, medical education, and healthcare innovation. Professor Mishra presently serves as the Vice Chancellor of Atal Bihari Vajpayee Medical University in Uttar Pradesh. Prior to this, he founded and led the AIIMS in Jodhpur. His academic journey is marked by exceptional achievements, including graduating with top honors from King George Medical College, Lucknow, and acquiring advanced qualifications in general surgery and surgical oncology. He has held various leadership positions across AIIMS institutions, promoting innovative research and compassionate healthcare. Internationally, he has been honored with fellowships at institutions like the Mayo Clinic and Johns Hopkins Medical Center. With over 230 publications and active participation in medical societies, Professor Mishra is a recognized leader in surgical sciences and medical education, esteemed for his commitment to academic excellence and service to underserved populations. It is our pleasure to invite all the participants to engage actively in this session under the able leadership of Professor Sanjeev Mishra, whose experience and vision will surely inspire impactful dialogues. Welcome, sir.
Good morning. We've got two very distinguished speakers for this session. And may I invite Professor Praveen Sharma, our first speaker. And I've known Professor Sharma now for over 2 decades. He was the Dean of Research and Head of Biochemistry at AIIMS Jodhpur. And he has nearly 340 research publications. He's a fellow of the National Academy of Medical Sciences, fellow of the American Association of Clinical Chemistry. He's editor-in-chief of the Indian Journal of Clinical Biochemistry. He's the secretary for the Asian Pacific Federation for Clinical Biochemistry. He has a lot of original work on metabolic syndrome, atherosclerosis, and metal toxicity. So Professor Sharma would be talking on clinical and molecular insights into lead toxicity. Professor Praveen Sharma, sir.
Thank you, sir. My association with lead is of almost 25 years. When I first got associated with George Foundation in sometime in 2000, and lead foundation mission was to reduce gasoline lead in this country. Since then, we have created many centers across the country. Around 35 centers are there, National Referral Center for Lead Projects in India. And we have also Association of Indian Association of Lead Awareness and Research. And our main motive was how to mitigate lead toxicity in the population. That is most important. We know much about the lead toxicity. Lead affects most of the organ system in the body. It also affects DNA. It also affects a lot of molecular mechanisms are affected by lead toxicity. So we have been talking about many things for the last 2 days, core research. But the thing is, basic thing, a divalent metal, which has no application, no role to play in the body, is lead. And it is widely present all across, everywhere in this universe. And we have been using lead every day. Lead is present everywhere. Even food is adulterated by lead. Our water is polluted by lead. All those working in the smelters or lead industries or battery industries or paint industry, they are badly affected by lead toxicity. But we have never thought about this. Our association then recently helped Emron batteries. Emron batteries was at the verge of closing because most of the workers were found to have blood lead level in their blood lead level above 60 deciliter. That was very alarming situation. We helped them, we taught them, we created awareness program, and ultimately now most of the workers in Emron batteries are free from lead toxicity. And it was such that even family members of that industry workers, they are also well aware of lead toxicity. What about the WHO? You make it full screen instead of notes. No, I want to see full screen here also. Make it full screen. I don't want notes. Yes. So lead exposure causes significant burden of disease. The Institute of Health Metrics and Evaluation estimates more than 1.5 million deaths globally are attributed to lead toxicity. Lead toxicity earlier known was lead poisoning. It is a slow poison which may cause death if its level reaches above 100 microliter. So this is 21 report. If I look back, there was another report released by this agency where this figure 1.5 was just 0.9 million. Look at the difference in 2 years, it has grown to almost double. This indicates how important is to look at the lead toxicity in this. And we must look how we can mitigate this poisoning. And other 33 million years lost to disability. Children are particularly vulnerable, and WHO has estimated that lead exposure accounts for almost 30% of the global burden of idiopathic development intellectual disability. Then what is the safe blood lead level? Various agencies, or there are many regulations and recommendations. Earlier they made a cutoff 10 microliter to microdeciliter. Then they reduced to 5 microdeciliter. Then finally CDC said, okay, fine, let us make it 3.5 microliter. Gram per deciliter. But now WHO say not even a single traces of lead is safe in the blood. So there is no cutoff for lead. Have you ever thought about, I'm going slightly away from, sir, I'll take 20, 25 minutes. Have you ever thought about that lead level in our blood? No. But we have read many things in paper and magazines also. Lead toxicity everywhere, in food. Lead chromate is used in haldi, and other lead oxides are used in different food. Your apple which you eat every day, it is polished by some lead salt so as to make it shining, fresh. Isn't that? But we never. And most of the time, we don't even wash this. We will buy from the market and immediately eat. Similarly, banana and all these, so as to make them ripe, lead is used everywhere. And lead is very important. Also, it protects us from when we travel in airspace, when we travel in plane. plane is painted by lead. It protects us from various UV radiations. So lead is important. We have to live with lead. But at the same time, we need to see how we can protect ourselves from lead toxicity. So there are various recommendations given by various agencies, various regulations are there, but how effectively they are implemented, at least in developing country, no. There is no such implementation anywhere. We have conducted, when we were in Jodhpur in 2012, we established lead referral center in Jodhpur. And we started various programs, lead awareness program among children. We have educated as many as 30 schools in Jodhpur. We educated policemen, traffic police for this. We educated even teachers, and we made them leaders. They will disseminate the information to children and develop the awareness among them. So various programs were created in Jodhpur, and because children are, it is the most vulnerable class because of their hand-to-mouth behavior, which results in mouthing and swallowing of lead-containing lead coat or lead-coated. We have sometimes misconception that a pencil, lead pencils we call this. What is used in lead pencil? It is lead or what? Something else? In pencil, what is that? Why pencil? We say it is harmful. Children should not chew pencil. What is that element which writes in pencil? It is a graphite. It is not lead. But the pencil which is polished, shining, colored pencil, that is lead. And most of the time you see the children keep on chewing that. That is harmful. Similarly, yellow toys. And if you look at the garden, most of the gardens, because yellow color is very attractive, and that yellow color contains maximum amount of lead. Similarly, most of the school buses, they are yellow. That is also harmful. Although children staying in, or we can say, lower social economic population is staying in houses where there's color keep on peeling off, that flags are also harmful for the children. That would be evident from our another study where we found that children studying in government schools had higher level of lead as compared to those studying in better school, private schools. And almost 18.87, that is almost 19% of children were found to have lead level of more than 5 microgram per liter. Isn't that a harmful situation? It affects the IQ of children, or neurodevelopment also affected by this. So we all know that blood can enter your body by inhalation or ingestion. I need not get into this. The particle less than 1 micromillimeter can be inhaled, and rest of the bigger particle would be stuck in the upper respiratory airways and later on swallowed. Organic lead can be absorbed from your skin also. So this is systemic toxic associated with numerous adverse conditions and diseases in human. There is also evidence that adverse effect below 10 microliter, as I said, WHO says no safe level. There can be a lot of things below 10 microliter, decrease in IQ, decrease in hearing, decrease in growth, impaired peripheral nerve function, transplantal transfer, this is also lot many problems are there. Even the 10 microgram per deciliter. We have again conducted one study in Jodhpur where blood lead level independently, we found that blood lead level independently predicted oxidative stress and antioxidant stress. It increased the oxidative stress and decrease in antioxidant. Selenium total antioxidant capacity was negatively correlated with blood lead level. Oxidative stress marker MDA and IL-6 level was positively associated with BLL. Cardiovascular disease, maybe because of increased lead level. And this figure illustrates the molecular and biochemical pathway of lead-induced cardiovascular. It affects once lead is there, it increases oxidative stress, it interferes with the calcium-dependent enzyme system. It also causes increase in free radical, decrease in nitrous oxide in the blood, and ultimately it might lead to hypertension, atherosclerosis, thrombosis, and renal injury. We have seen this also affect the renal functions. Since lead tend to induce injury in proximal tubule, kidney injury molecule KIM and neutrophil gelatinase associated lipocaine are appropriate urinary marker for lead injury of kidney. Oh. So it affects the reproductive system also if the level is below 10 microliter. Sir, this is not moving. Make this to move. This is not moving. Because this is not working. So as I said earlier, mother lead level is affected by affects children. The neurocognitive status of 6-month-old infant was found to have low neurocognitive status, and because and a slower speed of information processing in infants are found with the high blood lead level of mother. So this is how it enters the fetus. It enters through the placenta and umbilical cord. Ultimately, it crosses the blood-brain barrier and reaches the brain, where it affects the cognitive impairment is there. This is how this affects the nervous system. And our own finding which indicated that blood lead level has a significant direct correlation with the abnormal neurobehavior. It affects the serotonin, dopamine. It also affects the BDNF level, and it causes neurobehavioral characteristics which shows the significant association with the BDNF level. It affects the immune system also in the body. Most of the time, this is associated with increase in IgE level, which indicates that there is a shift from the Th1 to Th2 immune system. We have also examined this and found that the significant increase in the IL-4, IL-6, and TNF-alpha, and decrease in the level of IL-2 and IL-10. So this clearly indicates that it affects the immune system also. Affects your skeletal system. Hemopoietic system, 3 enzymes which are most affected by lead, that is ALAD, aminolevulinic acid dehydratase, synthetase, and ferrochelatase. Both the 3 enzymes are affected by lead. Respiratory system is also badly affected by increased lead level. Lead and gastrointestinal system. There is hardly any system which is not affected by lead toxicity. Lead also acts as the endocrine disruptor and delays puberty and menarche at blood lead level as low as 3 microgram per liter. This is overall scenario, how this lead affects multiple organ system in the body. If I look at the molecular aspects, lead affects the SNPs. It also affects the epigenetic mechanism, DNA methylation, histone modification, and miRNA. Even DNA repair is affected by increased lead level. So these are various SNPs which are affected by lead. ALD1 and 2 may have a protective role, whereas ALD2, it has got the adverse effect. ALD2L is associated with high lead level. 1 minute, sir. So this is epigenetic process which is affected by lead. DNA methylation is affected by lead. Histone modification is badly affected by this enzyme. Both the enzyme histone deacetylase and histone acetyl transferase and histone methyl transferase, they are found to be affected by lead. MicroRNA level is also, affected by lead. In vivo animal studies has clearly showed the high exposure of lead can deregulate the miRNA 29, 132, 146 and all this. In occupationally exposed population also, in a study conducted in China and India in our own center, revealed the deregulation of miRNA such as miRNA 148, miRNA 141, miRNA 212, 222, etc. So this is again our own finding. There's a dysregulation of miRNA 221, miRNA 150 has been observed to be affected by this. Last. So lead exposure is associated with increased DNA damage and reduction in DNA repair capacity. All the 3 enzymes of DNA repair are affected by lead. This is also again our own study. So facts remains that lead exposure is attributed to more than 5 million deaths globally in 2021 as data given by the WHO. Exposure to lead can affect multiple body systems and particularly harmful for the young children and women of childbearing age. Lead is distributed to the brain, liver, kidney, bone, everywhere in the body. Lead in bone is released into the blood during pregnancy and becomes source of exposure for the developing fetus. No level of exposure of lead is known to be without any harmful effect. This is the key fact. The harmful effect of lead exposure on health are entirely preventable. So, it is preventable. Prevention is cost effective. Therapy is very expensive. There is a chelation therapy, EDTA therapy and penicillin therapy is there, but that is very expensive, not easily available in the country also for the poor people. So pure prevention is better than cure. Thank you very much.
Thank you, sir. It was a very big topic that we were covering. If there are any questions from the House? Sir.
It is thought-provoking. Let us work at small elements also.
Sir, your talk was very nice but frightening. with the lead toxicity and things, I would have liked to see few slides mentioning how to prevent lead toxicity, and if you are affected by this toxicity, then what is the cure? These two most important questions are there.
The best, if you are affected, you are found to have lead in the blood. Best thing is you must look how this lead has entered your body. It is through occupation. As I said, we have taught Amazon workers how to get this blood lead level reduced in their. And also guideline also says, remove that worker from the active job for some time.
So further exposure should be avoided.
Should not be there.
But once you are exposed and lead is there in your blood,
Yes.
how to get rid of it?
It takes long time. Then you have to go for, so that's why I say, try that you are not exposed to lead. There is no level is safe. Then go for the chelation therapy. Ultimately, that is very, that's not the cure. Very difficult. Prevention is better than cure. Just look around your surrounding and see that you are not exposed to lead.
Lots of air pollution is there.
Yes. No, most of the time pollution is not there. Those working near the industry, smelters, battery industry, paint industry, these painters, they are more, vulnerable to this. And secondly, not only these people, but at the same time, their family member is also affected. You will say how? Because the cloth which you are wearing, you will go to your home and that will transfer their lead to their family also. So better take bath, change your clothes before you go to home.
Thank you, sir. Any other question or we? So, sir, thank you, sir, for a very good insight into lead. Now, invite our next speaker, Dr. Shirisha Nagotu. She's assistant professor in the Department of Bioscience and Bioengineering at IIT Guwahati. She received her MSc in biotechnology with distinction from University of Essex, PhD in molecular cell biology from University of Groningen, and her research group focuses on mechanisms of organelle communication, mitochondrial and perioxysomal dynamics, and how they influence aging and disease. She's a member of the NASI, and she's a mid-career Lady Scientist Award recipient in biogerontology and also served Power Grant. Dr. Nagotu, madam.
Thank you, sir. Thank you very much for the very kind introduction. And I'm very happy to be here in front of everyone to talk a little bit about what we are doing in our group here at IIT Guwahati. So the name of we call ourselves Organelle Biology and Cellular Aging Lab. So we are looking at the interjunction between organelle biology, dynamics of organelles, and how they contribute to cellular aging. So we had a fantastic talk yesterday about movement disorders and how what are the causes of movement disorders and how we can study them. So I'm going to talk a little bit about one of the movement disorder, that is Parkinson's disease. But nothing with respect to neurons here, but we're actually using yeast as a model system to study Parkinson's disease. So we look at the cell biology, what type of intracellular pathways are affected, and how we can understand this using yeast as a model system. So with the paucity of time, I will try to keep it very general. If there are any questions and feedback or suggestions, I'll be very happy to interact after my talk. So we are looking at different aspects of organelles in my lab. So we basically work on peroxisomes and mitochondria in the cells. So we look at the biogenesis of these organelles, how these organelles are responsible or how they are affected upon cellular aging. And last but not the least, we are also looking at how aging or neurodegeneration organelles are affected in these situations. So I'm going to talk about only that topic today, some recent data that we published, and by one of my PhD students who is also here in the audience, Tanvira, we just published a data that is with respect to this organelle dynamics. Sorry about that. So I'm just skipping this slide because we already heard about Parkinson's disease yesterday. Okay, I'm not able to move the slides. Yeah. Okay, so the clinical symptoms, I think we all know that we have loss of dopaminergic neurons from the brain. There is formation of Lewy bodies. So this is what actually I'm going to talk about. So how we can mimic formation of Lewy body-like aggregates using yeast as a model, and how we can actually look into this in a little more detail as what pathways are affected. And the gene or protein that I'm going to talk about is alpha-synuclein. So this is a protein that actually forms the aggregates, which are the major component of the Lewy bodies that are present in Parkinson's disease patients in the neurons. So this is the protein. Again, I'm just skipping this slide because there's a lot more of details about the protein, how it forms aggregates, what are the different pathways that it is affecting. Several mutations in the protein have been identified in patients, and these mutations are causing divergent effects. So the disease, effect of the disease is different for different mutations. So we'll talk about 2 mutations of this protein in this talk. And one important aspect that we are looking at is oxidative stress, because that is a hallmark of any kind of movement disorder or neurodegenerative disorders. So we are looking at 2 organelles, that is mitochondria and peroxisome, that actually contribute to this oxidative stress in the cells. Now, we heard a lot of talks which were directly dealing with neurons, which are the perfect models to study these kind of things. But there are several aspects that we cannot do using neurons. There are certain limitations which we cannot use them, or we can use other model systems which can fasten the speed of knowing these things. So primates, Drosophila, rodents, C. elegans, so there are several models. We are using yeast as a model because of several advantages. We can do a lot of genetic manipulations very easily. A lot of genes in yeast are very conserved. We also have the same genes. 31% of these genes have homologs in humans, and 50% of these genes are actually disease-causing genes, right? So we have a lot of similarity and homology with these genes. And in literature, it's already proven and published that yeast can be used as a very good model for studying Parkinson's disease, because we see a lot of protein aggregation that is very similar that is happening in neurons. So we can express these proteins, and once the aggregates are formed, we can actually track what kind of pathways are affected in yeast. I just want to mention here, so the Nobel Prize for autophagy was actually the discovery that was made in yeast. And then now we know that the same genes, the same pathway is actually conserved throughout, even in our cells. So it's a very good model system to study basic cellular pathways. So we're going to look at a little bit about protein aggregation. And as I just mentioned, so yeast is a very good model to study all these important pathways. Again, I will just skip this slide. So I'm only going to talk about mitochondrial dysfunction. Now, so again, a little bit of emphasis here. I would want to talk about peroxisome, an organelle that is masked under the function of mitochondria, because mitochondria and peroxisomes share a lot of their functions, especially in oxidative stress and in beta oxidation. A lot is known about mitochondria, but we do not know much about peroxisomes. So my lab is interested in understanding the role of these organelles that are peroxisomes. And very briefly, for those who do not know what exactly peroxisomes are, so these are ubiquitous organelles. They are present in all eukaryotes, in most eukaryotes. So they are single membrane bound. So this is very interesting because mitochondria is double membrane organelles, so peroxisomes are single membrane bound. And they have a very protein-rich matrix, meaning the inside of this organelle, so there is a single membrane and the inside is rich with proteins. Most of these are enzymes, actually. So these are enzymes which are oxidases that produce hydrogen peroxide, and there is also an enzyme called as catalase that decomposes peroxide, right? So it actually maintains this Ross balance very nicely because it produces reactive oxygen species, and it also has an enzyme that can decompose this reactive oxygen species. Now, another interesting difference from other organelles is that it can import folded proteins. So for all those who are into protein biology, it's interesting that folded proteins are imported from the cytosol into the organelle. That means that the membrane has a very interesting receptor complex that is present on the membrane that can import folded proteins. Now, we use yeast because we can actually induce peroxisomes when we culture yeast on oleic acid medium, which is a fatty acid medium. So because peroxisomes are needed for beta oxidation of fatty acids, you can simply put the cells on medium that has oleic acid and you have a lot of peroxisomes. So this makes it easy for us to understand a lot of questions when you have a lot of material that is more peroxisomes. So here I'm showing an electron micrograph which shows how peroxisomes look like in when yeast cells are grown under glucose conditions, that is where there is no fatty acid. So you have a large vacuole here, you have a large nucleus. These are all things that we learned in our cell biology. And here you can see with arrow marks that these are very, very small peroxisomes, tiny structures, tiny circles. But the same cell, now when I put on oleic acid medium, you can see these large structures. So these are the peroxisomes, because the enzymes that are required for beta oxidation of fatty acids are actually present in these organelles, right? So as soon as we put the cells on fatty acid medium, these enzymes are produced and they are going to be imported into peroxisomes, and the peroxisomes enlarge in size and number. So it's a very interesting model for us to study peroxisomes in yeast, basically. Now, I already mentioned this, so there are two universal functions of peroxisomes. Universal, what I mean by that these functions are actually happening in all cell types, yeast, plants, mammalian cells, all cell types. That is Ross homeostasis, so they produce ROS and they also decompose ROS, and they're also performing beta oxidation of fatty acid. Now, that's not all to peroxisomes, so I'm going to highlight the role of peroxisomes a bit here. So these organelles have also developed unique functions depending upon where they are present. Now, if you look at peroxisomes of the brain, because this is what is the theme of our meeting here, so they are involved in myelin production, they are involved in plasmalogen synthesis, they are involved in cholesterol metabolism and D-serine metabolism. So they're extremely important organelles in the brain, right? So they are very, very important for various functions of the brain. So as I already mentioned, so we will talk about what is happening to peroxisomes in a yeast model where we have alpha-synuclein that is expressed, which will mimic the formation of aggregates that are present in neurons. So I'm just going to skip this slide. So these are our yeast cells which are expressing alpha-synuclein. So this is alpha-synuclein here. And we have GFP tagged to the alpha-synuclein. Just want to mention here, we are using a variant of alpha-synuclein that is called as A53T. So this is a mutation that is dominantly seen in patients with Parkinson's disease. So we have actually made this mutation, and we can see that the protein makes these nice inclusions or aggregates inside the cells, similar to what is seen in Lewy bodies that are present in neurons. So this is already published, so this is nothing new. People have already studied this a long time ago. So what we wanted to check is what is happening to peroxisomes, because there are several other studies that spoke about mitochondria and other organelles and cellular pathways. So we wanted to look at what is happening to peroxisomes. So we did certain initial experiments where we looked at growth of the cells, what is the expression of the protein and all those things. But very interestingly, what we observed is, so these red structures here are peroxisomes. So we simply use a red fluorophore, which is tagged with a targeting signal that takes this fluorophore into peroxisomes. So you can easily visualize peroxisomes in red color. And in green is your alpha-synuclein that is expressed, which forms aggregates. We saw a tremendous increase in peroxisome number. So this was very interesting. So why should peroxisomes number increase in cells when you have expression of alpha-synuclein? So we did confirm this because what we are looking at in this slide is a matrix marker. I already mentioned that peroxisome has a membrane and the inside is the matrix. So this is a matrix marker, and then we also looked at a membrane marker just to confirm our findings that peroxisomes are actually increasing in number. Now, so why is this increase happening? That's the obvious question that we asked. So why are these numbers increasing? So how does this increase in number happen? So what we already know in the field is that peroxisomes in a cell can increase by different ways, right? So we have a model that we think can happen in cells. So if you can just follow on this slide here, number 1. So we think that peroxisomes can increase in number by a simple division of the organelle, right? So the organelle elongates its membrane, undergoes membrane constriction, then increases in number, right? So very simple increase in number. Now what happens when, for any chance, a cell loses its peroxisomes? So we see that peroxisomes can also be formed from the endoplasmic reticulum. Some of these proteins can be imported targeted to endoplasmic reticulum. From there, vesicles pinch off and you can actually have peroxisome formation. A role for mitochondria in this process is also being investigated in recent studies. So what we simply did is we knocked out two proteins that are required for this division process. So one is called as VPS1 and DNM1. We'll just forget about the names. So, but what I want to show here is in normal cells, wild type cells, we see a lot of peroxisomes. But when we knock out these proteins, we see only a single peroxisome, right? So that tells us very clearly that these proteins are important for peroxisome fission. Now, because we observed an increase in peroxisome number when we had alpha-synuclein being expressed. So we simply did alpha-synuclein expression in the VPS1 DNM1 cells to understand if this increase is happening because of division of peroxisomes. And what we saw here is that we actually do see an increase in number in spite of deleting the proteins that are required for fission. Now we went ahead and we also asked a question if this aggregation that we are seeing is actually causing an increase in number. So for that we actually looked at another mutant which is called as an A29S mutant, and this mutant doesn't form aggregates, right? So we just express the same mutant again, and here interestingly we do not see any increase in peroxisome number. So we have a lot of experiments. I'm not showing anything here because of the paucity of time, but very clearly it looks like aggregation of the protein is causing an increase in peroxisome number. Now, we did analyze other parameters with respect to what this aggregation is doing. So we do see increased activity of catalase, and we also do see increased oxidative stress that we also did by DHE staining in the cells. And I'll try to sum up because I think there is a paucity of time. So we did look at mitochondria. We also, so here we see in red is mitochondria. So we do see similar effects on mitochondria. Interestingly, A29S variant, which is not forming aggregates, is not doing any fragmentation in mitochondria. So, okay, we have a hypothesis. I'll just take a minute to say what the hypothesis is. We think that mitochondrial dysfunction is leading to a pathway which is called as retrograde transport signaling, meaning that the signal goes to nucleus. Nucleus gives certain kinds of transcription factors are actually upregulated, and this results in the increase in peroxisome number because several of these transcription factors regulate the number of peroxisomes. So that is the hypothesis. We are actually looking into it. We have some data that tells us that probably this hypothesis is true. So we are actually proposing that retrograde transport increases peroxisome number because of the signaling of mitochondria to the nucleus and increase in transcription factors. So I'll just like to conclude. Expression of alpha-synuclein results in an increase in peroxisome number in yeast model. This increase is not due to division of peroxisomes. So we are still looking at if the increase is due to formation from the endoplasmic reticulum, and that this increase is definitely dependent on the aggregation propensity, right? So because the various mutants are identified in the disease condition, and expression alters ROS homeostasis, some of the ongoing work that we are doing, and that's my lab from a recent meeting that we just attended last week. And yeah, I would like to thank the students and the funding bodies for the generous funding that we have. Thank you.
Thank you, Professor Nagotu, for a wonderful talk. We can have one or two quick questions if there are any from the audience. Yes, madam.
Thank you, Shirisha, for a very nice talk. I just want to know, because we always read PD as a human disease with the hypokinetic symptoms, and then we followed by behavioral at the cognitive decline, and there is a dopamine. So do we have dopamine in these cells? No. And see how these signals, how these symptoms you just see in yeast on the basis of which you can just say that this is a PD model or something like this.
Yeah. So actually, we get this question always, so I think that's why I started the talk when I also mentioned that we only look at the cell biology pathways that are affected in PD. So we know that autophagy is affected. We have these aggregates that are formed, which are not being able to be degraded in the neurons, the Levy bodies, or the aggregates of alpha-synuclein. So we are not actually looking at the disease condition, but we are actually looking at the pathways that are being affected in the cells when you have misfolding of proteins. So again, because it was a brain-related meeting, I tuned my title as Parkinson's disease. And so the idea in the lab is to see if misfolding of proteins is actually causing any damage damage to organelles, right? So we already know that misfolded proteins can be trafficked to mitochondria, they can damage mitochondria and things like that. So the alpha-synuclein is an example of a misfolded protein that we are taking in the lab, right? So, yes, sir.
Do you get any aggregates similar to the lipofuscin pigment in the neurons? Any of the aggregates which characteristically matches the lipofuscin pigment?
No, sir. So again, this is only alpha-synuclein aggregates. So if you look at Levy bodies or any other aggregates, so there are several other components. So there is ubiquitin, there is actin, there are other things also. So we are only looking at a misfolded protein that is alpha-synuclein. So these will be different.
If you pass through this in a fluorescence microscope or fluorescence system, you can possibly get that, and it could become a very good model for studying the aging per se.
Yeah, we can.
It's because you are trying to replicate the neuron there.
Yeah.
So in an aging neuron, the other part is that.
Yeah, sure.
That will be very interesting.
Sure.
Thank you, madam, for a wonderful presentation. And last question from Professor Rao.
Yes, sir.
The East is a model for many of these studies for a long time. You know, there are many studies.
Yes.
One question in this field for a long time now being discussed is that an aggregated protein per se might not be toxic.
Yes, sir.
So what does it do? It's aggregated is a dead-end molecule.
Yes, sir.
It will not be causing anything.
Yeah.
So what might be the reason for peroxisomes increase?
Yes, sir.
Now we have a non-aggregating mutant.
Yeah.
That is not aggregating, peroxisomes are not increasing.
Yeah.
Maybe in the aggregation process, some of the important molecules are getting trapped in the aggregate. So would you like to check the proteomics of the aggregates to see what is getting trapped?
Yes, sir. So that's again, as I've just answered, so aggregates probably also have ubiquitin or other important proteins that are probably trapped. One hypothesis that we just were also contemplating on is that, so there are certain papers that are talking about aggregates being targeted to mitochondria. So it actually disrupts mitochondrial membrane. So we did try to see if aggregates are co-localizing with peroxisomes, but we don't see any co-localization. So it's actually not directly physically interfering with anything. So, but as you said, there is something that is definitely there in the aggregates probably that is kind of influencing. So we are still, we're thinking about that. Thank you.
Again, till date, we do not know whether this aggregate, they are the positive or they are.
Yes, ma'am.
So it's again.
Yeah, agreed. So we had that discussion yesterday also with Abeta fibrils. So yeah, that is there always, yeah.
Thank you, madam.
Thank you so much.
We express our heartfelt gratitude to both distinguished speakers for delivering such informative and thought-provoking presentations. We remain deeply grateful to our chair, Professor Sanjeev Mishra, for your valuable time and dedication. Now I request Professor Sanjeev Mishra to kindly come forward on stage to felicitate our first speaker, Professor Praveen Sharma. Thank you, sir. Now I'd like to call upon stage our second speaker, Dr. Shirisha Nagatu. Our chair, Professor Mishra, will felicitate Dr. Nagatu. Thank you so much, sir. Thank you, all the speakers. The next session is the Young Investigators Talk, which we will start within 10 minutes. Now I would request all of you to join us for a tea break at the venue foyer of Conference Center.
He's online. So first speaker is online. Dr. Debrat Dash. 10 minutes, sir.
Okay, sir. Okay, sir. Thank you, sir. Thank you so much, sir.
You can share the screen. You are audible. And you may please start.
Am I audible, sir?
Yes, you are audible. Please start.
Okay, sir. Okay. Thank you.
We'll remind you 2 minutes before
good
your
morning,
10
everyone.
minutes end, right? So please start.
Okay, okay, sir. Okay, sir. Good morning, everyone. My name is Dr. Debrat Das, and today I'm here to present on my topic, protective potential of natrum sulfuricum and natrum phosphoricum in alcohol and acetaminophen induced brain damage.
Your slides just don't show any text. Is it to do with the internet or is it some other technical issue? Yes, now we've got it. Your first slide, please. Full screen.
Okay. Visible, sir?
Yes, please start.
Okay. So how COVID-19 and liver cirrhosis are connected to each other. Cirrhosis is a serious condition that causes severe scarring of the liver. It occurs when healthy liver cells are replaced by scarred tissue. According to the WHO, alcohol consumption is a factor in about 3 million deaths globally each year. During COVID-19, the use of acetaminophen increased up to 3 times than normal. Cases of chronic liver disease and liver cirrhosis increased during COVID-19 pandemic and was reported to be between 3% to 11% in large observational studies. Leads to hepatic encephalopathy damaging brain. There were indication and reports that simultaneous consumption of alcohol and acetaminophen caused liver disease and liver cirrhosis, but the mechanism of action was not very clear. Slides are not moving.
Can somebody see slides are not moving?
Okay.
Yeah, it's moving.
Okay, okay. So there are different stages of liver cirrhosis, such as healthy liver, compensated cirrhosis, which can be cured, that is stage 3 liver disease, the decompensated cirrhosis, which cannot be cured, that is stage 4 liver disease. There are different types of liver disease, and as you can see in this particular data, the alcohol related liver cirrhosis in India is almost 90 to 95%. Why biochemic tissue salts are used? Tissue salts, that is biochemic salts, maintain homeostasis within the living tissue. Loss of cell homeostasis leads to the manifestation of different symptoms. The action of biochemic tissue salts are directed to the tissues of the body directly, thus making it well indicated in the treatment of deficiency on the cellular level. So based on this background information, my objectives were identification of novel potential target, that is UTR pathway, to mitigate acetaminophen and alcohol-induced hepatoneurotoxicity during liver cirrhosis, to characterize biochemic tissue salt, that is natrum sulfuricum and natrum phosphoricum, as a potent therapeutic agent against acetaminophen and alcohol-induced hepatoneurotoxicity by defining its biochemical and molecular targets at cellular level. So this is the experimental design. All total 30 Wistar albino rats were randomly divided into 5 different groups, such as normal, alcohol control, liver cirrhosis plus natrum sulfuricum, and liver cirrhosis plus natrum phosphoricum. The target organs, liver as well as brain, both parts of the brains were targeted, such as cerebellum and cerebral cortex. Liver cirrhosis and brain damage induced by alcohol and acetaminophen. While sacrificing an animal, we could observe drastic change in the color of the liver And the damage can easily be seen in case of liver cirrhosis, brain also. How to confirm liver cirrhosis was induced or not? Confirmation of liver cirrhosis was noticed by increased expression of GST5. Post-treatment with natrum sulfuricum and natrum phosphoricum regresses the liver cirrhosis towards normal. This is the targeted pathway, the UPR pathway, the unfolded protein pathway, protein response pathway. The GRP78 and GRP94 activate the IRE1. The IRE1 further activate the XBP1. Then in the second sub pathway, the PERK activate the EIF2 alpha by phosphorylation. The EIF2 alpha further activate the ATF4. And in the third subgroup, the ATF6 binds to the Golgi body and performs ATF6 alpha, which further activated by transcription nucleus. The GRP78 is a mature endoplasmic reticulum belonging to the large chaperone family of hits of protein 70 molecules. The GRP78 plays a valid role in cirrhosis activity. There was a significant increase in the expression of GRP78 in liver cirrhosis. Natrum sulfuricum, natrum phosphoricum restored the level towards normal in liver as well as in case of brain also, the cerebral cortex as well as cerebellum. But interestingly, in case of cerebral cortex, as you can see, the GRP78, there was a isolation of another isoform, that is in case of alcohol control as well as in case of liver cirrhosis. But after the treatment of natrum sulfuricum, the
Recording in progress.
extra isoform was found to be diminished. The IRE1 is the most evolutionary conserved branch of UPR. IRE1 initiates a program with both pro-survival as well as pro-apoptotic components in the presence of misfolded or unfolded proteins. There was a significant increase in the expression of IRE1 alpha in liver cirrhosis. Natrum sulfuricum, natrum phosphoricum restored the level towards normal, both in case of Western blotting as well as the RT-PCR. The similar results were obtained in case of XBP1 also. In case of brain, the cerebral cortex as well as cerebellum, the similar results were obtained in case of IRE1 alpha as well as XBP1. When we of the results of our immunofluorescence data, we can easily found that the expression of immunofluorescence was found to be increased in case of liver cirrhosis, and the damage was found to be more in case of alcohol control as well as liver cirrhosis. When given the treatment of natrum sulfuricum, natrum phosphoricum, it was found to be decreased. The PERK branch of UPR transduces both pro-survival as well as pro-apoptotic signal following the accumulation of unfolded proteins in the endoplasmic reticulum. As you can see in case of liver, the extra isoform was found in case of alcohol control as well as liver cirrhosis. When given the treatment, the natrum sulfuricum was found to be more effective as compared to natrum phosphoricum. The similar results were obtained in case of EIF2 alpha as well as ATF4. In case of PERK as well as EIF2 alpha, the similar results were obtained in case of brain, both cerebral cortex as well as cerebellum. The ATF4 is a protective gene for the endoplasmic reticulum and oxidative stress, and we activate genes required for the various forms of the same stress, thus regulating the adaptive function of the cell. The similar results were obtained in case of as well as the ATF4. The ATF6 also, when we measure the ATF6, the similar results were obtained in case of cerebral cortex as well as cerebellum. The immunofluorescence data also corroborated with our results. From the results of the UPR pathway, we can conclude that natrum sulfuricum, natrum phosphoricum are the efficient global agents which alters nature of protein misfolding in liver cirrhosis. Till date, no group has studied the potential of biochemical tissue salts to affect the nature of protein folding in medical or pathological conditions. We also perform different behavioral analysis such as the footprinting test, the open field test, as well as the catalepsy test and the body posture or string test. the results suggesting that from the results of the behavioral experiments, we can conclude that natrum sulfuricum, natrum phosphoricum may be used as a potent nootropic agent against brain damage caused by hepatic encephalopathy induced by liver cirrhosis. This is the first report of the biochemical issues of natrum sulfuricum, natrum phosphoricum as nootropic agent in any medical or pathological conditions. We also characterized our drug, that is the biochemical issues of natrum sulfuricum as well as natrum phosphoricum at weight number 3550, 3200, which functional group is sulfonazole. We also characterize our drug in case of NMR as well as UV visible spectroscopy. The range was 245 nanometer to 301 nanometer. This is the summary of our study. The Wister albino rat, when given alcohol plus acetaminophen, it leads to liver cirrhosis and brain damage. Natrum sulfuricum, natrum phosphoricum leads to normal liver. What is the take-home message? Despite of the success rate of homeopathic medicine system among the masses, due to the lack of scientific evidence of homeopathic system of medicine, is still considered as a placebo medicine and placebo by many researchers worldwide. The findings from the present investigation for the first time provides an in-depth insights into the mechanism of action of biochemical tissues of natrum sulfuricum and natrum phosphoricum at biochemical and molecular levels, thereby confirming the effectiveness and validation to the homeopathic tissue system. These are the list of publications, total 13 publications, 11 papers and 2 book chapters included. These are the acknowledgement. I would like to thank ICMR-SRF, UGC, DST SARB, DBT Builder, DST FIST, NASI and IIT Guwahati for providing me opportunity to present my research paper. Despite of not being present there, I am able to present that. It's a very good thing in itself. These are the references of my study. Thank you so much. Thank you so much, sir.
Thank you, sir. That was a Shinkansen presentation, and so it's open for any questions from the House. You went really fast. Professor Rao, sir.
Yeah. Sir, actually it's almost 10 minutes presentation. That's why I have to present very.
Professor Rao.
Thank you, sir.
Whether it is a homeopathic sodium, whatever you said, natrum phosphoricum, that means
natrum sulfuricum and natrum phosphoricum.
That
yes,
means sodium phosphate. That's a sodium phosphate.
Yes.
So now can we check sodium phosphate and get the same result?
No, sir. Actually, homeopathic works in a concept of mother tincture, which is diluted almost 90 to 95% to make the sub, that is 3x, 6x. You may know that. There are all total 5 different potencies.
I fully understand, but my point is, if I take sodium phosphate in a low dilution, would it show the similar effect? If it doesn't show, only your compound shows, then your homeopathic theory may be understood. So no,
Yes,
otherwise,
sir,
how do you understand this? Yeah.
But the toxicity may happen in that particular case when we use the sodium phosphate directly. But homeopathic is used with the concept of mother tincture to avoid the consequences of that particular drug.
Okay. Thank you so much. And thank you, Dr. Dash. So now we go to the second presentation, and I invite.
Speakers, I have a quick announcement to make. I will just go through the order of the talk once for your convenience. Now we have Dr. Lekhan Lodhi. Next up we have Dr. Pankaj Srivastava. Next up we have Tapan Kumar Chaudhary. Next we have Tapas C. Nag, and we end with Umesh Kumar. Please be ready for your talk. So now over to sir.
So Dr. Lekhan Lodhi, online or physically? Physically. Dr. Lodhi, please. So Dr. Lodhi is not there? So we go to the third, is Dr. Pankaj Srivastava from University of Allahabad. Dr. Srivastava is here physically.
Do we have Dr. Pankaj Srivastava?
Okay. So next is Dr. Tapan K. Chaudhary from IIT Delhi. He's there, Dr. Chaudhary. Oh. So, okay, we'll have him after Professor Chaudhary. Professor Chaudhary is already here, so we go ahead with yours, sir. So Professor Chaudhary will be giving his talk.
In the presentation mode.
Yeah. You want first screen, sir?
Yeah. Good morning. A lot of thanks to NACI organizer, and I'm equally happy to see that this time I got inducted in NACI fellowship, and I also got an opportunity to speak one of the research problems which we are working in the lab. It's a very preliminary work, so maybe more questions would be attracted rather than understanding a lot of things. So since the title of the talk is a potential intervention on one of the amyloidosis process caused by a protein beta-2 microglobulin, which is associated with dialysis-related amyloidosis. So for the dialysis patient, this happens. So from a very, very basic and fundamental level, whatever we have got up to here, we are going to tell like this. It's a typical, the people who are aware with the literature, something is known about the process of amyloidosis, where native protein actually acquire a conformation which is facilitating the formation of fibril through the formation of protofibril. So keeping that particular thing in mind, when we are going to monitor the process of beta-2M fibrillation and its intervention by a peptidomimetic molecule, that's why this background information is given here. So the protein which is forming the amyloid during the dialysis related cases, which is beta-2M. The protein is like a small, about 99 amino acid polypeptide, monomeric form, and this protein is, that's why like just better to go to how this amyloidosis happen caused by the beta-2 microglobulin. So this beta-2 microglobulin is a component of the major histocompatibility complex for the antigen presenting cells. So when antigen presentation to the when the antigen presentation to the T cells completes, then this component beta-2M gets dissociated usually, and that beta-2M then get processed in our kidney. It's a normal situation. However, in some cases for the dialysis patient where this beta-2M protein is not getting processed, so it won't be eliminated from our blood, and that causes the enhancement of the concentration of the beta-2M protein. It has been kind of, somewhere reports are there, anything maybe from 25 to 50-fold excess of the beta-2M happens in those cases. And those extra protein, they have affinity to the synovial cells, and from there through different processing, it can cause the amyloid which are deposited in different junctions. Like, something is shown over here. So now the thing is that so far the intervention against this dialysis related amyloidosis are, I should say, bit limited. What people do, they have some kind of column and pass the blood through that particular column, which will be obviously removing some specific size of the amyloid, but there are soluble aggregates which are also not prone to be eliminated through that. And like surgery, renal transplantation, those are the kind of things, if at all this kind of thing happens. But I believe like there might be some alternative approaches could have been thought about. So from a protein researchers' point of view, we are thinking like with many other people, whether or not the formation of this amyloid can be controlled. I mean, either diminishing or reducing, whatever may be. Let's see what have been shown very initially from our experiment. So this is like, different kind of intervention towards the, I should say, protein aggregation process, which finally leads to the formation of amyloid if it happens in a structured way. Many small molecules, they stabilizes the native structure, which might prevent the aggregation process. Peptides can interact with the peptide region and the protein, which can also limit the stability of the protein molecule. And these peptidomimetics, I mean, they have some kind of uses. They can provide some sorts of structure, mostly like, the beta-sheeted structure, which can compete during the formation of cross beta-sheeted structure, which are a major initiation point for fibril formation. So keeping that particular thing in mind, we have chosen a molecule. It is known in the literature, peptidomimetic, but this is kind of a specially designed and synthesized molecule, which it doesn't have any, not coming from FDA approved drug or anywhere else. Usually like, chemists from our own institute, they keep on synthesizing different molecule. So this bispidine and its two hand is having a tripeptide, leucine, valine and isoleucine, that forms a very nice beta-sheeted structure which might compete during the formation of fibril. So here the rationale of the study, if we consider that this is the way the fibril formation is happening, where the peptidomimetic can intercalate in the conformation of the protein molecule, that may lead to something like, reduction or something can happen. With this thing, preliminary experiments which have been done, like, typical, make a fibril with the beta-2M protein and then add this molecule in a rational way. Like, maybe 1 to 10 stoichiometry, 1 to 20, and so on and so forth. Keeping in mind also there might be higher concentration of this peptidomimetic toxic for the living system. So with that rationale, it has been used for its experiment. And now, very quick, like, couple of seconds, the protein, it's a recombinant protein has been prepared and the protein has been characterized with its typical published secondary structural elements and using biophysical tools and techniques.
2 minutes.
And the fibrillation reaction was also optimized under electron microscope. Then the real experiment which has been carried out, the fibril formation reaction, unattended fibril formation reaction and the fibril formation in the presence of that particular molecule, that was initially monitored by thioflavin T assay, like the thioflavin which binds the cross beta sheet structure. And from here, if we see like the extent of thioflavin T fluorescence is also decreasing with respect to the addition or dose dependent manner with beta to microglobulin fibrillation using that molecule. So there are like, two things are happening. First of all, the thioflavin T fluorescence is decreasing with like, a 20 excess molar ratio, and then also the half time, means lag phase is also increasing, which might be slowing down the fibril formation reaction. So, I mean, I have to show something like, over some kind of gross result from this table, what we will be looking after. While treating with this peptidomimetic in a 1 to 20 molar ratio, we found that the lag phase is really increasing, the extent of thiophanate fluorescence decreasing, and the half time is also substantially decreased. So, which is grossly telling I will just take maybe 1 minute, I will just go to the conclusion right now, I am almost done. So, this is the thing. So, I am just reaching to a conclusive slide over here that will be telling me the final thing itself. Just a second. So, this is going to tell the crisp of this experiment. So, this rationally designed molecule which inhibits the kinetics of acid-induced fibril formation is slowing down. It is not completely decreasing. Then this molecule, while binding with a specific conformation of the beta 2M, it diverts or alters the route of fibril formation. That's why the fibril formation pathway decreases. I mean, we have supporting experiment on that, and it specifically bind to the specific structural conformation of beta 2M. It doesn't bind to everywhere. I mean, when a specific conformational entity forms, then only this particular molecule binds over there. So, the outcome of this experiment is a very preliminary study that this peptidomimetic can compete in the fibril formation process. It can reduce the kinetics of the fibril formation, and the further studies are going on over here exactly in which of the kinetic stage or the pathway this molecule is intervening. That would be an interesting thing for the future. So, we are working on that. Thank you very much. Sorry, the presentation was not made for 10 minutes.
Thank you, sir. It's open for questions.
Very nice talk. I have two questions. One is related to the affinity of this designed peptide to the protein, and second part is, did you observe any specificity of this peptide to only this protein or some other partners?
So, very typically, as I am telling, these questions are kind of very obvious questions. The answer to the first question about the affinity, and you might have seen this is working partially when 1 to 10 stoichiometry, 1 to 20 stoichiometry in micromolar range. The affinity is in the micromolar range is the affinity. Okay. So, this is one of the things. And second thing is that we while working on another a lysozyme related amyloidosis, we use this molecule. Okay. And almost in the same molar ratio we used it, we couldn't see much of a difference in the fibril formation propensity in that particular case. But it should be done on many more controlled things before you say, oh well, this might be a potential intervention. Yeah.
If there are no questions, thank you, sir.
Thank you very much.
Thank you, sir. Our next speaker is Dr. Pankaj Srivastav from the University of Allahabad, and he will be online for his presentation. Dr. Srivastav, can we have you? So, Dr. Srivastav, please. So, Dr. Pankaj Srivastav, you're online? Can you hear us? Dr. Srivastav, can you hear us? So, Dr. Srivastav, is he there?
Yes, sir, he's there.
Yeah, so he's not there.
He's online, but it's not responding.
Why? Can somebody give him a call, or we go with the offline? Right. So Dr. Srivastav, please contact him. We go with the offline presentation. So Dr. Tapas C. Nag from the All India Institute of Medical Sciences, New Delhi. So, sir, 10 minutes for the presentation.
Yes, I'm a good runner.
We don't want you to run, sir.
Yes, sir. Thank you very much. It is always fascinating to come over to this place because this is my motherland. My motherland, I was born here, and there is a popular song, when it is raining, children never use school buses. They like to play to the rain. So I'll be talking about how photoreceptor cells die from the human retina. So we have got about 6 million of cones, but by the end of 9th decade, that is 90 years, we lose about 2 million of cones. That is about 1/3. And it is very disastrous because nature has created that design that we must have 6 million of cones so that we can see anything very accurately. So when we lose about 2 million of cones, it is very dangerous for the system. So we have to know why these photoreceptor cells die and how they die. So this is the human retina. This is lying outside the brain, and it is a mini brain, but just outside the cranium. So it is a mini brain also. So one unique structure here is called the macula, which is loaded with carotenoids in the macula. But in spite of this, the retina or the photoreceptors undergo damage due to exposure to light. So this predisposes particularly the retina from attack by these agents like lights or pollutants, etc., present in the atmosphere. So photoreceptor cell death is common in certain diseases like retinitis pigmentosa, diabetic retinopathy, and in age-related macular degeneration. Especially in AMD, we can see that we gradually lose the central vision. Initially it is peripheral, then gradually the central vision. So question is why photoreceptor cells die in AMD. The hypothesis is that because the retina is continually exposed to light, oxidative stress is generated. So this cumulative oxidative stress may favor photoreceptor cell death. But how to prove that? Now question is the eyes with AMD are not available. They are available only after death of the patients. So this limits to see the AMD pathogenesis, and that is also lack of suitable animal models. But we can study the aging human eyes because aging is a risk factor for AMD. So we can utilize aging eyes. So we have utilized aging eyes starting from 4th to 10th decade. These eyes are actually from donation cases where the cornea is used for transplantation, but the remainder of the eyeball can be used for research, but they are not useful clinically. And photoreceptors are highly differentiated structures. So we have one outer segments which is responsible for light sensation, inner segments where ATP synthesis happens, and then one part for protein synthesis, and then signal continues through the synapses. Now first, the outer segments are nicely organized in lower ages, but with aging they become disorganized, and once they disorganize, many things happen. So one important aspect is that this organization is due to that they undergo lipid peroxidation. So one marker we have used 4-hydroxy-2-nonenal, which is a marker of lipid peroxidation, and these outer segments undergo lipid peroxidation, and this is the problem. So what type of cones are particularly affected? So we have found by co-localization that it is the LM cone, that is longer medial wavelength sensitive cones, that are affected with lipid peroxidation. And because of this lipid peroxidation in the outer segments, the opsin proteins cannot be accumulated into the outer segments. You see, normally the proteins are located here in the outer segments, but because of the damage to the membranes, the proteins mislocalize to the synaptic terminals where no ion channels are there for phototransduction. As a result, these cones start misfunctioning. So this LM-opsin mislocalization is a predictor of increasing cone anomaly with aging. Then the mitochondria also undergo changes. They become darkened, and there is loss of complex 1 expression. And in many cones, this fusion can be seen. Mitochondrial fusion is unique, fusion is good, fusion is bad. So fusion is there, so, but this fusion cannot protect these photoreceptors, the cones from dying, because there is a defective autophagy. So what we have found is that mitophagy is there in the photoreceptor cells, and there are damaged mitochondria, and these are all nicely sequestered by autophagosomes, but these damaged mitochondria are not digested by lysosomes. Why? What is the problem? The problem we have detected is that there is a problem with microtubule maintenance. Microtubules undergo disarrangement, and because of this, the lysosomal compartments from the cell body cannot travel along the microtubules to reach to the synaptic terminals. As a result, autophagosomes are there, but they cannot be digested. So this lots of autophagosomes in the synaptic terminals create toxicity to the cells, and ultimately the cells die. So this is the paper regarding this microtubule distability we have found, and there are many proteins like microtubule associated protein 2 and tau, all these undergo degeneration. So the cones are also degenerating from these parts, from these parts. And this is also about the tau protein that is also undergoing damage. So here the cones are not positive for cones. And because of this loss of autophagy functions, the photoreceptor cells start dying by apoptosis. So apoptosis is going on. And about 28% of the cells die by the end of 9th year. That is our calculation. And this is also happening in the human peripheral retina, that significant numbers of photoreceptor cells are also dying. So that is very pathetic situation for humankind. So to understand that, we utilize certain animals with a light exposure and iron toxicity. So we utilize domestic chicks and spec dolly rats and expose them to light of various intensities and duration. And we utilized Wister rat models for iron toxicity, and iron was given at the rate of 750 milligram per kg body weight per week until 20 months of age. So what we found is that in the same way, photoreceptor cells are damaged in prolonged exposure to light. Prolonged exposure to light means 18 hours of light. So you can compare our lifestyle this time. Nature did not know that we had to spend our life in this way. It was initially 12 hours light, 12 hours dark, but now we spend our day hours or light times until midnight, which is about 18 hours light. So this prolonged light exposure is a very detrimental condition for the retina, and opsinox expression is damaged, and there is also photoreceptor cell death by apoptosis in rats also. And there is protein kinase upregulation, and in iron toxicity model, we found that mitophagy is disturbed, and the main culprit is GPX, that is glutathione peroxidase, which undergo deregulation. And the future perspective is that we have two issues, like we must preserve our retina from excessive light exposure, and number two, we have to know how to prevent ourselves from iron toxicity. If we can do whatever may be the methods, it could be mechanical, it can be photomechanical, it can be chemical, etc. We can protect our photoreceptors from these two aspects of light toxicity and iron accumulation with aging. Thank you.
Thank you, sir. It's open for questions from the house.
So excellent talk.
I had to go fast, I'm sorry.
No, excellent talk. So have you only looked at mitophagy, or have you looked at general autophagy also? I mean, any other?
No, I was interested only with mitochondria, because mitochondria are the organelles, they are undergoing severe damage to the cone cells. So what we found is that in mitophagy, so somehow this mitophagy is activated. Ample evidence is there, mitophagy is activated there in the photoreceptor synapses. But these autophagosomes are not cleared, means that these damaged mitochondria are not cleared, because lysosomes cannot travel because of breaks in the microtubule.
Have you also checked any mitochondrial protein expression, upregulation or downregulation?
Yes, I have, but I could not show here. There are lots. I have only shown here the oxidative phosphorylation markers, complex one, but other proteins I have studied all related to autophagy.
Okay.
So
Thank you. Thank you.
Time did not.
Professor Rao, sir.
Yeah, I think all cell types with the age, like your span that you're talking about, 90 plus, things like that, all cell types will undergo apoptosis and they keep dying.
Yes, sir.
So what is unique about a retinal cell death? That's one point. And second point is, did you look at reptiles? In the reptiles, this can be replaced, it can be regenerated. Okay, retina can be regenerated in reptiles. So would the reptile process would be different from this? Any possibility?
Exactly different, because all mammals have limited potential for regeneration, and photoreceptors do not have any potential. But there are some stem cells in the retina that can generate certain cell types, but not the photoreceptors. That is the problem. And what is problem with the retina as such, and human retina in particular, is that the rate of cell loss is very high, which is unparalleled by any other areas in the brain. It is 20 to 30% of cell death is tremendous. Even in Alzheimer's, this is not the rate. It is minimal. And nowhere in the body, be it lungs, heart, liver, pancreas, nowhere cell death is so much of prominent. 30% of cell death with aging. I'm not talking about disease. Disease is something different, but aging is something different. So with aging, 30% loss of cells is a problem. So reptiles are unique in that sense. They can regenerate, but we cannot. Even the rats cannot.
So are you looking at reptiles to see what we can learn?
That would be nice, definitely. And if we can extrapolate those ideas even to the mammalian system, that would be nice.
So what is your advice to all of us?
Yes, I have thought about this. Means during daytime we have to utilize some precautionary measures. Means like US people say that it is always preferable to use certain kind of specs that will allow limited light entry into the eyeball, number one. And regarding iron toxicity, nobody has yet advocated anything that how we can protect ourselves. But if we can take some foods that are not rich in iron, so we can protect our retina from iron toxicity, because iron will accumulate with aging. And iron accumulates not only in the liver and spleen, but iron has a tendency to be accumulate also to the retina. So that is very funny. So this iron is a culprit even to the Parkinson's disease, and that is why people have found that whatever is happening inside the brain, like in Alzheimer's or Parkinson's disease, can also be traced at the retina level, because the retina also suffers due to iron toxicity. So,
thank you, sir. Really enjoyed the presentation. Thank you, sir.
Increased autophagy means intermittent fasting.
Yes.
Would be helpful.
Yes. So autophagy dysregulation is a problem here, and if you know, means it is known, pharmacological intervention is known in many other organs that we can induce autophagy by pharmacological means. But with the retina, those drugs cannot interact. They cannot act. So we have to find out the ways how to induce autophagy at the level of retina. So that we don't know.
Thank you, sir.
Thank you, sir.
Do we have BK Tiwari and Manoj Kumar Gupta here? If they're here in the audience, please proceed to Hall 3. Thank you.
So, last presenter is Dr. Umesh Kumar from University of Allahabad. And is Dr. Umesh Kumar online? Oh, he's here. Been able to trace you. So 10 minutes is there, right?
Sir, the pointer. नहीं ठीक हाँ फुल स्क्रीन चाहिए Okay, thank you. Good afternoon, respected chairperson, sir, ma'am, and dear colleagues. Today I'm here going to present my research work on the topic impact of chlorpyrifos on photosynthesis and oxidative stress in brinjal seedlings, implication of signaling molecules GABA and NO on toxicity amelioration. Agriculture is the cornerstone of Indian economy, accounting for 18% of the country's total GDP and employing over 45% of the population, providing food safety to more than 1.4 billion Indians while reducing agricultural land availability is a challenging task. Globally, the pesticide consumption in agriculture was found to be about 4.3 million metric tons in 2023 and it would rise around 4.41 million metric tons in 2027. Pesticides are chemical compounds commonly utilized in widespread farming practices to protect the crop from pests, weeds and diseases, resulting in increased productivity in agriculture and achieving World Food Safety Goals. In India, 2023-24, over 67,964 tons of pesticides were applied to agricultural crops. Indiscriminate application of pesticide in agriculture causes phytotoxicity, oxidative stress, and photosynthetic emission in crop, resulting threat to food safety. In this slide, figure A shows the countrywide pesticide usage in 2023, in which the maximum pesticide was used by Brazil, about 800.6 thousand metric tons, and India uses only 40.1 thousand metric tons. And figure B shows the state-wide pesticide consumption in India 2022 to 23, in which the Uttar Pradesh was the highest, and followed by Maharashtra, and minimum used by the Goa. Vegetables are the essential to a balanced diet due to the presence of vitamins, minerals, and dietary fibers and phytochemicals. Vegetable contamination results in substantial economic losses globally and contribute to food insecurity. The application of signaling molecules has been considered as a promising strategy to mitigate the toxic effect of chemical contaminants such as heavy metal pesticides. Among signaling molecules, GABA and NO have been used to explore the ameliorating role in toxicity induced by a pesticide chlorpyrifos in a widely cultivated vegetable brinjal. The present work to evaluate the role of GABA and NO in mitigating chlorpyrifos toxicity on morphological, physiological, and biochemical features, including growth, biomass accumulation, oxidative biomarkers, and antioxidant activity in brinjal seedlings. This slide shows the experimental setup in which we use Solanum melongena variety BR112 with 8 treatments including CK as a control, CP chlorpyrifos, and CP plus GABA, GABA aminobutyric acid, CP plus NO nitric oxide, CP plus GABA plus NO, CP plus GABA plus LNAM inhibitor of NO, and CP plus GABA plus CPTIO scavenger of NO, and CP plus NO plus MPA inhibitor of GABA. This image shows the experimental procedure from sowing to sampling. This slide shows the morphology. This slide shows the effect of chlorpyrifos on the morphology of brinjal seedling, along with the application of GABA and NO. Seedling treated with CP alone significantly reduces the length and biomass, whereas combined effect of GABA and NO significantly improve the growth, and combined effect of GABA and NO show the maximum growth improvement. This slide shows the effect of chlorpyrifos toxicity on growth attributes, that is total length, fresh biomass, and total dry biomass along with the application of GABA and NO. In case of total length, fresh biomass, and dry biomass, the maximum reduction was found in case of chlorpyrifos treated seedling as compared to control and other seedling, and maximum increment was found in case of combined treatment of GABA and NO as compared to control and other treatments. This slide highlights the effect of chlorpyrifos on photosynthetic pigment, that is chlorophyll A, B, and carotenoid, and gas exchange parameter. In case of chlorophyll A and B, the maximum reduction was found under chlorpyrifos treated seedling as compared to control and other treatment, and maximum improvement was found in case of combined treatment of GABA and NO. In case of carotenoid, the maximum improvement was found under chlorpyrifos alone treated seedling as compared to control and other treatment, and maximum reduction was found in combined treatment of GABA and NO. In case of gas exchange parameter, that is photosynthesis, CIA internal CO2, and stomatal conduction and transpiration rate were maximum decreased under CP treated seedling as compared to control and other treatment, whereas maximum improvement was found under the combined treatment of GABA and NO. This slide shows the table impact of chlorpyrifos toxicity on various parameter of photosystem second photochemistry, in which the quantum yield of quantum yield of photochemistry, yield of electron transport per trap exciton, quantum yield of electron transport, performance index of PS second, and energy flux for absorption of photon per reaction center, at trap energy flux per reaction center, electron transport per reaction center, and energy dissipation flux per reaction center. The all parameters were significantly reduced in a CP treated seedling as compared to control and other treatment, whereas maximum improvement were found in combined treatment of GABA and NO. This slide highlights the effect of chlorpyrifos on oxidative biomarker, that is SOR, H2O2 and MDA, and antioxidant activity, that is catalase, GST, POD and SOD. In case of oxidative biomarker, the SOR, H2O2 and MDA, where maximum improvement was found in case of chlorpyrifos treated seedling as compared to control and other treatment, and maximum reduction was found in case of combined treatment of GABA and NO. In case of similar results were also found in case of various antioxidants, that is catalase, GST, POD and SOD. This slide shows the in vivo staining image of brinjal seeds under the CP stress. Under CP stress, the leaves show the maximum strong staining with SOR, H2O2, MD and MDA, whereas minimum reduction was found in case of GABA and NO combined treatments. This slide shows the effect of chlorpyrifos toxicity on instrumental size in brinjal seedling, along with the elevation of their toxicity with the application of GABA. The maximum instrumental size reduction was found in case of chlorpyrifos treated seedling alone as compared to control and other treatment, whereas the maximum improvement were found in case of GABA and NO. Conclusions. The chlorpyrifos toxicity markedly impair brinjal seedling, reducing growth, photosynthesis, efficiency, antioxidant balance, and instrumental size. GABA and NO alone mitigated toxicity by improving growth and photosynthesis while reducing ROS accumulation. GABA plus NO together show the strongest protection, restoring growth and photosynthesis while minimizing oxidative damage beyond control levels. GABA plus NO co-treatment sharply reduce oxidative biomarkers indicating enhanced cellular redox homeostasis. GABA plus NO treatment significantly enhance antioxidant enzyme like catalase, GST, POD and SOD, indicating improved detoxification ability under chlorpyrifos stress. Inhibitor studies like LM, CPDIO and MPA validated the interdependency of GABA and NO signaling, confirming that their synergistic interaction is essential for toxicity mitigation. Recommendation: GABA-based treatment should be emphasized for mitigating chlorpyrifos toxicity, as GABA play a dominant downstream role in improving photosynthetic efficiency, antioxidant defense, and growth performance in brinjal seedling. Future studies should focus on elucidating the molecular crosstalk between GABA and NO signaling pathway, including gene expression and metabolic regulation, to develop targeted strategy for enhancing pesticide stress tolerance in crops. Acknowledgement: I would like to thank organizing committee for wonderfully organizing the 95th Varanasi Annual Session Symposium on Healthy Brain, Mind and Cognition from Computer to Clinic. I gratefully thank to CSIR New Delhi for providing research funding to Professor S.M. Prasad under the Amateur Scientist Project, through which I received support and research associate. Thank you.
Thank you, Dr. Mesh Kumar.
Thank you, sir.
Can we have a couple of questions if there are any? So you've said recommendations about lab, but when you come down to practice in agriculture, do they translate into actually work in the field?
Yes, sir. I try to ये सब पहले लैब में अभी ट्राई कर रहा हूँ, इसको फील्ड एप्लीकेशन पे अभी बाद में सर इसको अप्लाई करेंगे.
लैब से एप्लीकेशन में होगा तो कैसे एप्लीकेशन में करेंगे? व्हाट डू यू सजेस्ट?
सर अभी हम इसको हाइड्रोपोनिक पे इसका इफेक्ट देख रहे हैं, क्या रिस्पांस है. फिर अगर अभी जीन लेवल पे सर करना है कि कैसे हम इंटरनली गाबा और एनओ के सिंथेसिस को हम बढ़ा सकते हैं, फिर इसके बाद सर उसको हम इम्प्लाई करेंगे उसमें प्लांट वो soil
कमर्शियल प्रिपरेशन आती हैं जिसमें कि ये नाइट्रिक ऑक्साइड मिला हुआ हो जो आप पेस्टिसाइड जो डालते हैं उसके साथ?
सर ये सोडियम नाइट्रोक्लोराइड है वो जो यनो का वो सोर्स देते हैं हम लोग. Thank you, sir.
So I think we've finished with all the presentations and thank all the presenters for the wonderful work that they presented. I'm handing it back to the organizers.
Thank you all the speakers for sharing their well-articulated perspectives. And I'd like to thank Professor Sanjeev Mishra, chair of this session. We will be proceeding with the discussion recommendations and valedictory session at the Hall 2, which is the same hall itself, within 10 minutes. So I would like to request everyone to kindly be seated here. So this is the ending of this session, and we are proceeding within 10 minutes.
start our valedictory session. For that, I request our President, Professor Vinod K. Singh, to take his seat. Our sectional presidents, Professor Annapurnai Subramani, please take your seat. Annapurnai Subramaniam, ma'am, please. Professor Sanjeev Mishra.
So that we understand, common public understand. Sanjeev.
Our organizer, Professor Lata Rangan, ma'am.
We also didn't have one person online connected and then continue.
To start with, I would like to call upon stage Professor Ashok Mishra, Sectional President. Sorry. I'm so sorry. Professor Dr. Sanjeev Mishra, Sectional President for the biological section, to give his remark on the biological sections and the overall 2.5 days proceedings that we had.
Good afternoon. Professor Singh, President Nasi, Professor Lata Rangan, the organizing secretary, Professor Subramaniam, President for the Physical Science section, Professor Ashok Mishra, all the members of the Council for Nasi, all the seniors, all the newly inducted fellows, members of Nasi, all the speakers in different sections. The last 2.5 days, I would say, have been phenomenal because I've been sitting through all the sessions. I'm not a neuroscientist, nor do I work on neuroscience, but it's been an excellent learning, expanding your knowledge, and seeing the wonderful work that people are presenting. Because brain is one of the last frontiers of neurosciences, which I think slowly more and more we are able to decipher. And it was an excellent amalgamation of people presenting from engineering, from the medical side, from basic research. And on the last day for the biological science section, for which I was the president, and we had some very interesting presentations on that, starting about lead, then something about the yeast and its role in disease, and of course the different oral presentations that we had, 6 of them, where unfortunately only 4 presenters presented, 2 were not there. I wish those 2 would also been there, so that would have added to it. And they were very diverse from different areas and backgrounds of presentations, but they were interesting work, and there was a lot of original work, and all of it did have some translational effect and knowledge involved with it. And I would again thank Nasi and all the organizers and Dr. Lata for all the effort which she has put in, and her team here at Guwahati, for making us stay comfortable and ensuring that everything runs on time. And I think she's been driving that well, and that's something very important when we do scientific meetings. We always tend to go a little out of hand as far as time goes, but here I was really happy to see that everything was on time. And even in spite of the Indigo fiasco, a lot of us are here, and that is very heartening to see the commitment of everybody towards Nasi and its activities. And again, thank Professor Singh, Professor Ashok Mishra, all the people from Nasi, and Dr. Lata for really making it a wonderful experience attending NASI meeting, 95th NASI meeting at Guwahati. So do I announce this or do they get to announce later? What is the procedure? So for the posters which were there are two Best Poster Presenter Awards and there's one Best Oral Presenter Award. So may I call, request Professor Singh to give away the awards, President. So start with the Best Poster Presenter, Dr. Siddhant Saha. Siddhant Saha. So, what is the name? Oh, great. So you get a nice catch award. Next is Dr. Rekha Sharma. Yes. And now for the Best Oral Presenter, we invite Dr. Tapas Nag from AIMS, New Delhi. Sir was here. He was here a minute back. So that was a very interesting presentation on eye retina, effect of light and aging. So we can give it to Sir. Address. Affiliation. I don't have the affiliation. I think you're from IIT Guwahati and Dr. Rekha Sharma is IIT Guwahati. So you're what? Okay. And your area of work? Let her tell. You can't speak for her. Great. Congratulations. Professor Tapas Nag, you get the Best Oral Presenter Award, sir. Another feather in your cap, sir.
Connection. What is it? They can draw down connection.
All the awards were evaluated by fellows of the NASI who are external evaluators. For the poster judgment, there were judges. All of the judges were from outside, and there was an independent evaluation which they carried out for all the awards in the biological section, and same for the physical section.
Thank you, sir, for your insight. Now I call upon Professor Annapurnai for her insights.
Yeah, thank you so much, President Nasi, sectional presidents, and Dr. Lata Rangan. It was a great pleasure being here and interacted with a lot of researchers. I am from astrophysics background, but I learned a lot of biology, physics, etc. here. And I also would like to mention that as a sectional president, what I have carried out. So we had requested, the NASI had put out the announcement for the annual meeting, along with the special meeting under this theme of healthy brain, mind, and cognition. So we received a number of abstracts under physical sciences and biological sciences. So under the physical sciences, I think it was about 60 odd abstracts were received. And of that, we had to choose, there were abstracts which did not fall under physical sciences at all, so that had to be removed. And we chose some of these abstracts as for the young researchers' talk, so that was segregated as young researchers' talks, and the rest of them were assigned as posters. So, and that is how the sessions were drawn. And I think many of the poster presentations could come, presenters could come, but many of them could not come because of the travel issues, etc. And the presentations were done yesterday. Yesterday morning, the posters were put up. And we also had a set of evaluators for the posters. And these people, you would have seen people going around and asking you questions, etc. And these were independently carried out, and they were assessing the posters, giving them marks. And then they were compiled. And now that is how we have arrived at the best poster presentations. And also for the sectional biological sciences as well as physical sciences, there were chairs and co-chairs looking at the presenters and the contents, and they were deciding the best presenters for that session as well. So the physical sciences, I'm here to give you final awards for the poster presentations. We have 3 best poster presenters for physical sciences, and we don't have any speaker. We had only about half of the speaker available for the physical sciences, and it was not fair to give a judgment based on 3, so we don't want to give an award on the best speaker, but then we have 3 best poster presenters. So I call upon P19 Bimal K. Barik. And I request President Nasi to give away the awards. So I think he's not there. And we have P20 Chandralekha M.
NIT Arunachal Pradesh. I'm from NIT Arunachal Pradesh.
And we have P39 Neelam. Yeah.
I am Neelam from Dr. Bhimrao Ambedkar University, Agra.
So, yeah, thank you all for all your cooperation, and we missed. Oh, okay, Bimal Barik. So this is Bimal Barik.
Hello, Namaskar, Jai Jagannath. Sorry. Actually, I am Bimal Kumar from NIT Arunachal Pradesh, Department of Basic and Applied Science.
I also thank IIT Guwahati and the department for organizing this as well as providing all the required support. Thank you.
Thank you, ma'am. Now I call upon Professor Vinod K. Singh to give his remarks and insights.
Like everything, our NASI annual session and symposium comes to an end, almost end. And for the last 2.5 days, it was very exciting. In fact, all the talks were very good and quite enriching experience. They were more of a general nature so that people who don't work in the area, they can understand. For this, I would like to thank Professor Ashok Mishra and his team, Belare and Venkat, for working hard, and also the local organizing team under the leadership of Professor Lata Rangan for doing an outstanding job in organizing this session and the symposium. As per the tradition, we have 2 sectional presidents, biological sciences and physical sciences. And you could see that both gave outstanding talk. Not only they gave outstanding talk, they were able to get outstanding speakers in their sessions. So I would like to appreciate the efforts of Professor Mishra and Professor Subramanian. Of course, audience is very, very important. I could see in the hall, we have more number of people than we had on the first day after lunch. So I really appreciate your time. It is good to attend at least 80% of the talks. I always believe, I go to any conference, if there are 40 talks, I like to attend at least 25 talks, 30 talks. Sometimes phone call comes, some other work comes, online meeting, or that's a different thing. So all of you should think like that. If you attend a conference, you should try to attend at least 70% talks. That is kind of, we should be ethically bound to attend as many talks as possible. From NASI, we don't have any vice president, we don't have general secretary. We have a foreign secretary, Dr. Vatsa, and I'm the only one here. So maybe I would like to have input from Dr. Vatsa, and we have a council member, several of them, if they can say something about the theme symposium input, that will be nice. But restrict your statement for only 100 seconds. We have Professor Vatsa from BRC.
Thank you, sir. I mean, it was a wonderful experience. When I first heard this title, I was worried that as a physical chemist dealing with lasers, what will I understand? But as President sir also pointed out, that talks were really, really interesting, and we are going back from an enriching experience. And also thanks to Professor Lata Rangan for excellent arrangements. Thank you so much.
Professor Saurabh Pal.
Okay, yes, already. Yeah, thank you for giving me the opportunity. I think the President and Dr. Vatsa has already told that the conference gave you a variety of things. And I think this is where I would say at least the registered delegates should utilize the opportunity to interact with eminent experts who have come in different areas. And I think that is something, as Professor Singh told, that you must attend 70 to 80% of the talks. And I wish that was the case. In certain sessions, we found that the number of participants was a bit low, but we all understand the logic, the constraints. But I must thank especially Professor Lata Rangan for wonderfully managing. I mean, it's not very easy to do. I think we should give a big hand to her for organizing this conference. And of course, the session chairs for getting the meeting done.
Professor Singh and Professor Madhu Dixit, maybe one by one. Let them speak, then your turn will come. They are our council members, so I...
So with this topic, I thought most people will be biological sciences only. But it is great to see that a lot of people who are in physical sciences actually joined this meeting. And I believe that joining there will enhance the quality of science, especially in this area.
Yeah.
So, and thank you very much for all the, for organizing this so well.
Yeah, Professor Madhu Dixit.
Thank you very much. I wish to thank organizers for wonderfully taking care of all the requirements of the delegates and NASI members. This has been a wonderful experience, and for myself, I can vouch that I attended 80% of the session talks and really enjoyed being here.
Yeah.
It is a wonderful opportunity to meet people from different areas because NASI, INSA, and Indian Academy of Sciences, these meetings are very wonderful in that respect. And thanks to all the presenters and all the poster presenters and everybody who contributed to the variety and the quality for this conference. So thank you so much.
Yeah. आप दे दीजिए. आप डिसाइड करिए कौन पढ़ने बोलेगा.
I wanted to tell that when we are talking about Viksit Bharat, in 30 years to come, the largest population of senior citizens will be in our country, and brain health will be the major concern. The topic that was chosen is wonderful, and the lectures we had in neuroscience was really, really very interesting. And thank you very much for getting Professor Sood to talk to a wide spectrum of people from chemistry to neuroscience to listen about the brain function. That was wonderful. Thank you very much.
It's definitely a wonderful experience because the first time, by virtue of being inducted as a fellow, I have been able to join to this meeting. And believe me or not, like, it is so nicely orchestrated. Like, it's a mixture of different topic which got together. The biological science, physical science. It's also included, like, talk from top most persons from industry, health industry, philanthropists, etc., etc. So, I mean, first time, like, the type of statement I have gotten from these philanthropists, their views on the development of Indian science and technology, which amazed me quite a lot. Like, typical talks, typical science, typical things are always there. But when some person who are also a pioneer, who are also propagating their effect on the development of science, technology, research in India are amazing. And like, it's such a nice way, it's timely manner, and the topics, all those things really made me very happy. Like,
Thank you, thank you.
Thank you so much.
Acha, ठीक.
Thank you, sir. The most striking feature of this conference was that every lecture was delivered and time was very well kept. And all the arrangements from food to transport to the arrangement of the lecture halls was excellent. So for that, compliments to Madam Rangan. And the topic of the conference was very well chosen. It is a futuristic topic, healthy brain, mind and cognition, from computers to clinics. I wish that this topic should continue for a few more years, or maybe after 2 years, we should discuss again this topic. Thank you very much.
Thank you, thank you. Maybe I would like young participants who are below 40 to share their thoughts, suggestions, comments. Anyone? Otherwise, I'll pick up somebody. I think they are shy. Now, I also like to appreciate the effort of one person from headquarters, Dr. Santosh Shukla. He works actually, I always say, कि कितने degree काम करना है, तो I always say 365 degree evaluation. Some people think I don't know mathematics, which is true, but same thing, Santosh Shukla works 27 hours a day. It's very hard working, and I like to appreciate the efforts. And finally, before I take the chair, I like all of you to clap in the appreciation of Professor Lata Rangan and her team for doing an outstanding. Thank you. Yes, I think she's going to do it. She should have something.
Thank you, sir, for your comments and all the audience who have commented. Thank you so much. Now, I request Professor Lata Rangan to deliver her vote of thanks. Thank you.
Thank you, Kusum. At the outset, first of all, many, many congratulations to all the newly inducted fellows, because I couldn't wish them individually, so I'm using this platform to wish each one of them hearty greetings from my end, also from IIT Guwahati and also from the NASI team, which has already been done yesterday, but then we are just adding to that. Also, wishes and greetings to all the award winners of the poster session and of the Young Investigator Talk. Good afternoon, and welcome to this valedictory session of the 95th Annual Session and Symposium, which was themed on healthy brain, mind, cognition from computers to clinics. It is definitely a privilege for me to propose this vote of thanks on the behalf of the organizing committee. I think it is
much more difficult job than organizing an event because there have been so many players behind the scenes, in front of the scene, and I think knowingly or unknowingly we don't want to hurt anyone because since the time limitation is always there for us and we want to stick to that time. So my apologies at the first go, in case if I miss out, acknowledging the efforts which have been so sincere with full force and in a manner that I could not have asked for more. So all that you see is because of my organizing team. They have been my backbone. So my first gratitude, thank you, support goes to my organizing team. And I would definitely come back to that again as well. I think the whole process with regard to having this particular event here in IIT Guwahati, I think the journey started for us almost an year back. And when we expressed our intention that we would like to be a host organizing institute in conducting this 95th annual session, it was then that the president, the past president, Professor Balram Bhargava, and the incumbent president, Professor Vinod K. Singh, agreed that, yes, I think it has never been held in the Northeast region. This was, I think, maybe more than 40 years back. So I'm talking about 4 decades back when we had the event in the Northeast. So they wholeheartedly supported it. And so my thanks goes to the president, Professor Vinod K. Singh, for giving us this opportunity to hold this event here in Northeast and in IIT Guwahati. So the whole idea was that this would give a kind of an opportunity and a platform for every one of us to be part of this event and get to know the kind of the activity, task, engagement which NACI on the whole takes it up. And of course, befitting the topic of this symposium, which was on the healthy brain, mind, and cognition. So thank you very much, Professor Vinod, and to your team, and also to the NACI Council, and to every member of the NACI. Thank you very much. My thanks also goes to our convener, Professor Ashok K. Mishra, who's convener of this symposium, because we have this symposium and the annual session. So the theme of the event symposium was decided by Professor Mishra and his team, and of course, duly accorded and seconded by the entire NACI Council and the President. So I think definitely, as many of our guests have also said, that this might not be an area of our working or the research, but then I think probably each one of us who have attended the sessions, even though I was a part of an organizing team, I made and I ensured that I was, and so my attendance probably was also 80%. I ensured that I'm there inside the hall listening to the lectures, which have been really very stimulating and captivating. So there is a take-home message for each one of us from the lectures which we have attended to right from the day 1 session till the concluding day. So thank you very much to Professor Ashok Mishra, although he's not here, and also to the co-conveners, Professor Jayesh Ballare and to Dr. Venkat for crafting this different sessions in the scientific symposium. So my thanks goes to them as well. My sincere thanks to all our speakers. Some of you are here, many of you are probably have left, and I think despite their busy schedule, they could make it. Some of them probably couldn't make it because of the flight fiasco, which hit us badly. But nevertheless, as I mentioned during the inauguration session, I think we did have their wholehearted support, and we did have the presentations online. So my sincere thanks goes to each speaker, who have really given us the glimpse of the kind of the activity which goes into coordinating the aspects of the brain and the mind. Sincere thanks also goes to all our chairs and chairperson, co-chairs who have actually kindly agreed to chair the sessions which spanned all the way to the 10 sessions. So we just concluded the biological session. So my sincere thanks goes to all the chairpersons. My sincere thanks goes to our sectional presidents, Professor Annapurni Subramaniam from the Physical Sciences, and also to Professor Sanjeev Mishra of Biological Sciences for not only giving the sectional president talk, but then also chairing the sessions, which included the invited talks and also young investigator talk. Actually, maybe this is a kind of an activity which is part of the NASI program during the annual session where they do have the young investigator talk. But then somehow for the last few years that was not a part of it, and I'm so glad that during the last council meeting when I had gone to give a presentation with regard to hosting this particular event, there was this suggestion which came from the council's members that we should also have a young investigator talk so as to promote the young minds getting more engaged into the activity of the research and to make it much more in an inclusive manner. So we did have these young investigator talks. I think few of them did join us online, and the very good part was, I think, because of this flight fiasco, we did have a contingent plan so as to host it into our Zoom platform and also in the YouTube. And so that enabled us, not only the speakers to join us online, but then also the young investigators giving their talk. And as I gather, I think everyone were quite happy with regard to the talks that were given by our young investigator. And I hope that the purpose, the very meaning of having that talk was served. So thank you again to all our speakers, whether they are the invited speakers or the young investigator talk. So thank you very much. I think this event is because of them, and they are cementing this into a greater strength. Now finally, I think, yes, it comes to the local organizing team, and I think this definitely goes to the IIT Guwahati, right from our patron, Professor Devendra Jalihal. So when I approached him that we are hosting this event, he did ask me, Lata, are you ready for this particular event? The amount of the arrangements or the kind of the coordination that is needed to organize such an event where you are expecting such a high-profile dignitaries right from Padma Shri, Padma Bhushan, and all those who are very well crafted and niched in their own scientific domain. So are we ready for that? We said that yes, we are ready for it, and then finally I think we got the wholehearted support from Professor Devendra Jalihal, our director, the administrative team, the entire team which has come to an arena to help us, whether it is the logistic or whether it is the venue or whether it is the administrative support. So wherever we approached, we did get it, but then I do understand there have been certain limitations in addressing certain aspects, and we have taken note of that, which we plan to stitch it together in our forthcoming events, which we would definitely like to host it, whether it is a part of NASI or a part of our other organizations. So my sincere thanks goes to the entire administrative team, the staff. It also includes the media section. It also includes the outreach education section, because we could connect ourselves to those sections so as to have the children's science meet. It was definitely not an easy task to bring close to around 1,200 students, and those students have come all the way from far off places like Jorhat, taking 6 hours bus journey. So they were there, and then arranging that kind of a logistics definitely was a Herculean task, but then with the support of the Outreach Education Office, we could manage it. So entire thanks goes to IIT administrative staff, faculty, in helping us in bringing this event to the kind of the limelight that was needed for us. Of course, yes, my full backbone over here, which is my organizing team comprising of my faculties and my student volunteers. Now, I don't want to actually name them individually, but then this is the small thing which I can do. I can just put up this request that if they can stand up and then just acknowledge over here that the efforts which have gone in organizing this event is all because of them. So my faculty colleagues, each one of them have tried their best to address the request as and when that was put to them. So that includes my entire team over here, the faculty colleagues, staffs, and the student volunteers. So we did have this local organizing team and the student volunteer team. So if there are any limitations, please put the blame onto me. But then if there is some positive highlight which is coming out of this event, it is all because of them. So thank you very much. At the end, I just want to wish each one of you a huge round of kind of an acknowledgement for being present over here, and wish you all a safe journey back home because you all have come from different far off places. Safe journey back home, and for the time you are going to be here, you have a fruitful stay. Thank you very much. Thank you. Yes. Actually, I also wanted to put, I think on the day of inauguration, I missed the photograph because I was just helping our guest, the co-convener, Professor Jayesh Ballare, to come to that spot. So let's have, yeah. So we can
volunteers can come here for photograph.
So all the volunteers, please come up for a photograph.
You have to come quickly because
We
people
can go
have to
outside
catch their flights.
हम लोग बैठ जाए सर
हाँ, actually हम लोग
जिससे
बैठ
कि
जाएंगे।
पीछे भी आ जाएंगे दिख जाएंगे सर
अब बच्चे आगे भी खड़े हो सकते हैं। बैठ सकते हैं। बच्चों जल्दी आओ because people have to catch flight.
Go at the back.
I think she had a flight actually. She was up. सुदीप, sorry, सुदीप। उनको बुला लीजिए ना।